we can say good and great. That will be changed by the mental health treatment. So today's theme is beautifully suggests many lenses, one goal, athletes' well-being. That means we are having psychiatrists, sports psychologists, sports therapists, then physiotherapists, aquatherapists, sleep experts, strength and conditioning coaches, sport medicine physicians, coaches, family members, friends. This all together can make a good athlete. Every expert gives one lens, and together we become a complete human being, not just the athlete. So today we will explore case vignettes in sports psychiatry, then sleep as a performance tool, mind-body interactions in sport medicines, strength and insight, conditioning, nutrition and optimal athletic function, and POXO and athlete production, especially in minors. We are seeing in the US also, there is I think one lady was very much, the coach was there, and under POXO he was treated there. Then we will also witness today the conversation. I think that Mr. Dinesh Lad is not here. Oh, otherwise there was a good, because of this India crisis we are having some problems. We'll be having but powerful fighter story of struggle, strength and spirit from Miss Geeta Chouhan. She is the captain of Indian wheelchair basketball team. This is not a theoretical symposium. These are the real stories, real science and real solutions. As a psychiatrist, we must understand that these are the high performance mindset, recovery psychology after injuries, eating disorder, anxiety, depression, OCD, substance use in sports, suicidality also, and transition from active sports to retirement. So there are multiple things, multiple dimensions in sports psychiatry we are looking after. Let our athletes say, I can talk about mind just like I talk about my muscle, my diet, my training schedule. So let's sports psychiatry be present in academics, in national training camps, in rehab center, in schools, grassroots levels, in discussion everywhere. So we must build mentally resilient champions. As a EC coordinator, I am Indian Psychiatric Society EC coordinator for sports psychiatry. This conclave will not end today at 4 p.m. It will start the moment. So thank you, especially Dr. Mansi Bora. She is behind this sports psychiatry always. Last year also we have done with Mumbai Cricket Society, and she has done wonderful work. She has gathered a lot of people, and all organizations, scientific schedule, everything. She is doing relentless work. We thank Indian Psychiatric Society office bearers, Dr. Savita Malhotra. She is the president of Indian Psychiatric Society. Dr. Amrit Patalji, he is the secretary. Dr. T.S.S. Rao, Vice President, President-elect, Dr. Alip Siddiqui, Treasurer, Dr. Sujit Sarkel, Editor. And the most important behind this is the Sports Psychiatry Subcommittee of Indian Psychiatric Society. I would like to thank Dr. Sudhir T., Dr. Amir Khan, Dr. Anupam Rathod, Dr. Suvendi Mishra. He was also coming today, but unfortunately because of Indigo he is not coming. Dr. Mansi, Dr. Vaibhav Dubey, Dr. Devika Patil, and Dr. Amar Chende, myself as the EC coordinator. So I thank everybody for coming here. We should have a good program today, and everybody stick to the program till the end. Thank you very much.
Thank you so much, sir, for setting the tone of the day for us. And now let's dive into session 1, which is the symposium with many lenses and one goal. So I would request Dr. Amar Shinde, sir. Sorry, we might have a few technical glitches here and there, so please bear with us.
So I am going to introduce. Am I able to listen to me?
Yep.
I am audible? So, I'm going to introduce my mentor, my guru, and my director, Dr. Amar sir, who is the founder of Jagruti Rehabilitation Center. I must say, Jagruti Group of Rehabilitation Centers, Oliver Care, and Aroha Wellness Center. So he's a senior psychiatrist with over 18 years of clinical experience, consultant psychiatrist at Noble Hospital, Pune. He was formerly working at a regional mental hospital, Erabra, and trained under eminent mentors including Padma Shri Dr. Mohan Agashi sir. So he was a student of Dr. Mohan Agashi sir. Currently, he is an IPS Executive Council member. Along with that, he was a past Executive Council member for IPS West Zone branch, past president of IPS Pune branch. He leads Manu Jagruti Mental Health Awareness Campaign, provides free treatment and medicine distribution to undeserved communities. Along with that, he collaborates with pharmaceutical companies on new therapies in schizophrenia and dementia. He trains 8 postgraduate psychiatrists annually and a strong commitment to the advancing psychiatric education. So I welcome Dr. Amar Shinde sir. Give him a big hand. I need to say some of lines before entering into the new session. पर्दा उठने को है लम्हा है खास, हर नजर को है इस पल का इंतजार। सालाना मंच पर सज रही कहानी, सालाना हर एक मंच पर सज रही कहानियां, और यहाँ पर हर प्रस्तुति बनेगी सुनहरी निशानियां, हर प्रस्तुति बनेगी सुनहरी निशानियां।
Yes. On to Dr. Sagar Karya sir. So his series are always very funny and humorous. Today he tells us that he's a super strength. He's into practice since the last 13 years. He's an article machine with over 170 publications. He's a group chat admin of psychiatry, holds various positions in different psychiatric organizations. He's the anecdote ninja. From clinics to conferences, turns psychiatric principles into stories which become memorable. Definitely agreed on that one. Renaissance psychiatrist, researcher, leader, speaker and mentor. Also a good cook and a mimicry artist. We welcome you, sir. Now I would like to request Dr. Amar sir to kindly introduce Dr. Chandni Mehta ma'am.
Dr. Chandni Mehta, I just talked with her about her aquatic physiotherapy. She is a PPTH and physiotherapist, and she is aquatic therapist, founder of Aquamax Rehab and Wellness Private Limited, Annada Aqua Therapy Center, Chembur, and Pure Pilot Studio, Kandivali and Andheri. Committee member of ATNI board. So I think this is aqua therapy is coming up new ways it is finding in physiotherapy, and it is very helpful I think for the athletes. So please come and give us good insight about aqua therapy. Thank you.
So, good morning everyone, and hi, I'm Dr. Chandni, and it's an honor to be here on this platform, spreading awareness about aquatic physiotherapy. I'm glad that I'm having the first session over here. So I want the audience to just stand up. See, you have a physiotherapist in the room, so please don't mind. We are always thinking about more on exercise part, so So let's do some stretchings and all, please. Just neck movements, hand movements. Come on. Gear up at the start of the day. Okay. And I want just few leg movements. Yes, and few jumps now. Come on. I want to see. More stronger. Yes, more stronger. I see people giving up, sir. Please. Okay. Thank you so much. Please have your seats. And so this is something to do with aquatherapy. Just I want you to think that jumping on the land is so challenging and difficult at times. But when, just imagine yourself that you are in water and you are jumping. Isn't it more easier, right? So there where aquatherapy comes in the picture. Okay, yeah, okay. Yeah. So aquatherapy, a newer dimension towards rehabilitation. See, swimming, all the doctors you know हम हमेशा बोलते थे कि swimming is one of the best form of exercises, right? It's always there. And India is never a culture of swimming, but slowly and gradually it has come into as a water rehabilitation part. So aquatherapy, a new dimension to rehabilitation. So hi, I am Dr. Chani, and I have a clinical experience of 15 years, but from past 10 years I'm totally into aquaphysiotherapy. I have done my graduation, and after that I have done aquatherapy from Switzerland, which is an IATF certification. Okay, so now since it's a sports psychiatrics conference, I want to talk more related to sports and aquatherapy merger. When the athletes, it's a very high demanding performance nowadays, as we all know. They have to have a lot of back-to-back events and everything. So in the sports, this is a single profession can address to all the physical, physiological and biomechanical and recovery needs of an athlete. So I want to talk more on the lactic acid threshold. Nowadays we have seen that because of the high demanding performance on the land, there is a lot of lactic acid this thing. So with aquatherapy, there is a lot of lactic acid tolerance which is developed, and that's how the performance on the games is much more better. Aquaphysiotherapy becomes one of these important lenses, an approach that uses the unique properties of water to assist rehabilitation, recovery, conditioning, pain management and psychological well-being. Okay, what makes aquatherapy unique? So, a temperature controlled water. There are very well advanced equipments which are there, which is called as an aqua treadmills. I am sure everyone must have heard about these aqua treadmills, right? A certified aquatic physiotherapist which helps an athlete to meet its goal. Okay, there are a few pictures like pool lifts. So aquatherapy is also in a high demand with neurological conditions like stroke and all. Lot of pediatric conditions, special kids basically. Lot of orthopedic conditions, which is ligament injuries and many other injuries, which really helps to give 4x times better results compared to on the land. So that doesn't mean that the conventional physiotherapy we don't do. It's a combination of session where land and aquatic physiotherapy we combine together and gives best of the results. Okay. The properties of water, the buoyancy, the hydrostatic pressure, the viscosity and the resistance, the thermodynamic effects, as I already told, there are a lot of temperature controlled pools. See, India is in a weather, I mean there are mostly an outdoor pools, right? So now there are many temperature controlled pools, which is an indoor pools which have started developing, where we can take a lot of different kinds of rehabilitation in the water. So the picture what you are seeing is my pool, which I have developed an indoor pool inside the clinic, where we have aqua treadmills, and I have a team of 10 aquatic physiotherapists with me. It's always a one-on-one session, and there can be a group sessions also. Thus, aquaphysiotherapy offers physical, physiological, neuromuscular benefits and making it a crucial part of multidisciplinary sports care. Okay, role of aquaphysiotherapy in multidisciplinary team. It's athletic physiotherapy, orthopedic surgeons, there is a strength and conditioning coach, sports psychologist and nutritionist. So it's always a holistic approach. We don't say that, okay, only physiotherapy or something will really get the whole of it. It's always a holistic with the nutrition, with the psychiatrist and an orthopedic surgeon on the panel. Okay, why multidisciplinary care improves an athlete outcomes? It helps in a faster recovery. Due to combined physical and psychological intervention, it reduces the risk of overloading. There is a less stress of the joints, right? Do you all agree? Yeah. In the water, there is less stress, so you become the 1/10 of the more the level of the water, the lesser the stress on your joints. Athletes can perform sport-specific actions in water earlier than compared to on the land. It's a holistic well-being. So, as a physiotherapist, what I have understood all these years is it's not only the physiotherapy, it's always a holistic approach. Where I always want to focus more on the mental health of the patients also. Though it doesn't matter if it's an orthopedic condition, ligament injuries or any stroke rehab or any sports person. Everywhere it's a most of the pain and aches are psychosomatic, right? So we want to focus on the mental health of the patient. So how physiotherapy complements the other lenses? Aquatherapy is a bridge between an acute injury and a land-based training, a safe zone for early movements, a high intensity yet a low impact training environment, a psychological comfortable environment for an anxious athlete, right? I mean, the athletes are always under that sympathetic overdrive, basically. So we need to calm down. We need to have more parasympathetic, a key recovery tool for an high load sports. And it reduces the gap between the injury, rehabilitation, conditioning, performance and return to the sport. So when we use an aquatherapy as one of the tools, the return to the sports is much more earlier. That's we have always seen with an evidence-based practices. So to conclude, aquaphysiotherapy serves as a vital lens in multidisciplinary athlete care, offering safe, controlled and holistic rehabilitation through a unique therapeutic benefits of water. This is the picture what you've seen is something called as a Watsu. So have you heard about Watsu? The shiatsu in water is called Watsu. It's a deepest level of meditation in water. Why this is required? Can please, anyone can? So in water, it's a passive technique where we tell the patient or an athlete or XYZ person to just lie down. It's a temperature controlled water, right? Just lie down and there are a lot of passive movements in the water. So that helps to calm down, have more focused, relax the muscle tensions, improve the muscle tone of the body, and it has a lot of benefits. So I personally feel that unless and until you all don't experience, you won't understand that what is Watsu. Okay? So this is something called as Watsu. There are many other techniques that we use in water, something called as an I Chi. Okay, Tai Chi on land is I Chi in water. There are a lot of rhythmic movements that we use in water so that we can, always calm the patient or a sports person, help them to relax their muscle, reduce their, muscle tension, fatigue and everything, and it has shown a great improvement in their overall performances as well. So yes, there are few techniques called as an Halloween, there is called as the Bhadragas ring method, Watsu. it's more deeper into aquaphysiotherapy, so I just want to tell you the names and spread a little more awareness. But yeah, Matsu and IG are one of the best tools that we use for the sports rehabilitation. Okay, so just a short and crisp introduction about aquaphysiotherapy, and please, if anyone wants to.
Yes, thank you very much. It was a wonderful presentation and we got insight into the aquatherapy. I think people here also sure we can use this because injuries are very common.
Yes.
Sports activity has very much increased. Even all doctors are taking participation in cricket, football, everything is going on. So I think this is one of the best tools. And obviously swimming is best, so this is also best. Thank you.
Thank you, sir. Thank you.
Hello. So I don't have a question, but I have a comment. First of all, we need to thank Dr. Chani. She only arrived from Dubai at 3 in the night, and she's here looking so fresh. So what is that? I have hypothyroidism, and that makes your muscles quite weak, and so a lot of pain in the knees. So I went to her, and I did just 2 sessions with her. After that, we have a pool in our building. I can see a significant difference just with the use of aquatherapy. It's definitely swimming, but little bit of exercise. And after that, I have been promoting it myself. My conviction in aquatherapy was much higher after I experienced the benefits. So definitely, not just before or after injury, but even around for normal people with health-related difficulties, I think it works wonders.
Yes.
So thank you. Thank you so much, Dr. Chani.
Thank you, Dr. Mohammed.
So, definitely it was a wonderful session. Now, I would request Dr. Sagar Kadia sir to kindly introduce Ms. Apurva Surve.
So it's my pleasure to introduce our next speaker, who is Ms. Apurva Surve. खाना पीना बहुत important है. Exercise तो हम कर लेंगे, but food is the most important part, and we welcome you because she is a consulting sports nutritionist. She has more than 15 years of experience in the field of sports nutrition. You can see she has done her graduation, post-graduations. She is actually an awardee, recipient of lot of awards also, like Shiv Chhatrapati State Sports Award, Mumbai City District Sports Award. She herself is a player, so she can be the better person to know and tell us what nutrition should a sports personality should have. We welcome you and we are eager to listen to you. Thank you.
Good morning everyone, and like Dr. Chani, I will not make you stand and do some exercise, but yes, that was a wonderful breakfast here, nutritious breakfast, and now what I'm going to talk about, since nutrition is a very vast topic, so many fields in that, and sports nutrition is around the niche field like sports psychiatry, and in that also I will be talking more of sports nutrition and cognition health in athletes. So what does research say? So if you see, there's a lot many research done on nutrition, food intake of athletes and how it is affecting their mood, their cognitive function and whatever they, how they play on field. So LEA means low energy availability. What does low energy availability means? Like for whatever you do, your body needs energy. Okay, so almost 60% of that energy is required by the body only to do normal processes like breathing, your heart is working, your brain is working 24 hours. So 60% of the energy is required for that. And 40%, remaining 40% out of that, 10% is required for the food you digest throughout the day and you absorb all the nutrients and components out of that. And the remaining 20-30% is your physical activity. Now, imagine athletes who are training for more than 6-7 hours in a day, they're spending so much of calories or burning so much of calories in a day. So they will be burning around 5,000, so many calories in a day. Now imagine they need those calories for the physical activity as well as they require calories for their day-to-day processes which are happening 24 hours 7 in the body. Now what if my athlete doesn't eat enough of calories or doesn't consume enough of nutrients required for all these things? But my athlete is still practicing for 6 to 7 hours. So he will be using whatever is there in the body, all the calories or the nutrients for that purpose. Now I don't have enough of fuel for my body for the normal processes. So I have low energy or less of energy available for the day-to-day processes inside my body, and that is low energy availability. And when the athlete has low energy availability, it is going to affect all the systems in the body, including your nervous system. Okay, so there's a lot of research done, and this first is from IOC consent statement itself, which says that low energy availability is associated with irritability, poor concentration, low mood, sleep disturbances, and increased fatigue. And imagine if the athlete is facing with these issues, how the athlete is going to perform at an optimum level on the field or during events. Okay, even iron deficiency. Iron deficiency impairs attention, fatigue resistance, mood, even without anemia. Now there's a difference between iron deficiency and anemia. Anemia you call when you have low hemoglobin levels, right? But that low hemoglobin levels can be because of n number of reasons. It can be because of iron deficiency, B12 deficiency, B6 deficiency, and most of the times, in 95% of the cases of the athletes, when they come to us, we tell them to do the blood test. We also tell them to do the iron panel, okay, iron studies panel, and then we realize although the hemoglobin levels are normal, their serum ferritin, which is the storage form of iron in the body, is low. The transferrin saturation, total iron capacity, all these things are, not at the level. It means they are in the stage 1 of iron deficiency. Now when you have these levels, you're already in the iron deficiency stage, and then you start seeing effects like fatigue, dizziness, headache, which can be like one of the major factors for low performance in athletes. Even proper energy, protein, omega-3 fatty acids, micronutrient adequacy, all these things support your neuronal repair, inflammation modulation, as well as symptom recovery. As simple as carbohydrate feeding. We always, most of athletes, even athletes fear carbohydrates, saying that carbohydrates make them fat. But athletes require maximum carbohydrate because carbohydrates are like, the preferred fuel. It's actually a preferred fuel for everyone, but athlete, it becomes a preferred fuel. If your carbohydrate levels are depleted, the athlete actually can hit the wall or, bonking, all those effects which we call that. Athlete cannot go further or cannot do that activity if the glycogen levels, that is storage form of carbs, is depleted in the body. So as simple technique as carbohydrate feeding helps maintain attention, skill execution and mood in athletes, because your brain, it only needs glucose for functioning. So your energy for brain is derived from glucose, and what is glucose? It's nothing but carbohydrates. So if you are low on carbohydrates, the athlete is low on carbohydrates, obviously he'll be complaining about low concentration, headache and dizziness. Quickly on the topics which we are talking about, as I told about energy availability. Now the newest term, the recent term which they are using is relative energy deficiency in sports. So what does relative energy deficiency in sports means? Whatever the energy required for daily processes in the body is not enough, because most of the energy or most of the calories what the athlete is consuming is going for the physical activity. So there's a mismatch, and that also chronic mismatch over a period of months and years, the athlete is not meeting caloric requirement and hence not meeting the overall nutrient requirement for them, and the expenditure is too much as compared to the intake, leading to multi-system effects. Okay, so underfueled athletes, as I told, may present brain fog, irritability, low motivation and sleep problems, and the high risk groups for this red S is aesthetic, like your rhythmic gymnasts, dancers, figure skaters, endurance athletes like runners. Most of the elite runners do face that, and I'm not even talking about female athletes, but even it's seen in male runners or male athletes have red S. Weight category sports, you've seen so many weight category sports, combat sports, they will cut their weight and they'll be training also in their lower than normal weight, general weight, and then towards the competitive event, when they have weight, they will obviously go in the massive weight cut. So again, that's a high risk group. Usually what we screen for energy availability is if they are skipping meals. So we'll ask questions. So as sports psychologists or as sports psychiatrists, you also, if they are complaining of all these issues, just ask them, how many times are they eating meals in a day? Are they skipping meals? Is there a rapid weight loss? Are they into rigid dieting? Because we have seen athletes, even in a scenario where it's a get-together or a group setting, they will try to avoid food, or they will eat, but they will eat very little, or they will just eat salads or soup and not the other things. Or if they are training is a high volume training for longer hours and intensities also. So if you can just ask them these questions, maybe most of the symptoms can be cleared with food itself before giving any medications. Carbohydrates, as I told you, it's brain energy, because your brain needs glucose for its normal functioning. Okay, so all the prolonged high intensity work, and if the athlete is not on carbohydrates or on low on carbohydrate intake, it is going to lead to slow reaction time, impaired vigilance, worsens mood in sustained tasks. So we tell the athletes, so example I'd like to give you is when endurance athletes, when they are into events like which is going to last for 7 hours at a stretch, when talking about ultra endurance events or marathon runners or long distance cyclists where they cycle for almost 200 kilometers in a day, 300 kilometers in a day, they require sustained carbohydrates. So in between we'll be giving carbohydrate foods like bananas, salted dates. You can also give carbohydrate gels, so the carbohydrate levels don't drop down, because carbohydrates, once is we need to maintain the blood glucose level, and also we need carbohydrates for the muscles, because if the glycogen is depleted from the muscles, the athlete is going to hit the wall. It's not going to even perform one muscle movement beyond that. So that is very crucial. So usually, the mental errors after even in a match like football match or second half, when they say that there are certain mental errors or late game impulsivities, usually we ask them, what did you eat or drink in the 3-4 hours before the match or during the game. You will find people, during the match, especially football match, if they don't want to consume anything, usually they have sports drinks or they will have banana. You will find tennis players, during the half time switching, they will eat bananas or dates, or there are some fruit juice which they are having is nothing but your carbohydrates. And sports drinks also, some of the people also do mouth rinse, carbohydrate mouth rinse. It's nothing but, they will just put the carbohydrate sports drink or a carbohydrate drink in the mouth, swish it for like 10-15 seconds and spit it out. So this is just, it's a very simple yet effective technique just to, fool your brain that you're giving some carbohydrates. So there are certain nerves in your mouth which tell your brain that yes, fuel is coming, so please be active and please be attentive. So that's one more technique we use with our athletes. Other than carbohydrates, micronutrients like iron, vitamin B12, folate, B6, vitamin D3, obviously all micronutrients are important, but these three become major when you're talking about cognitive health. And checking for blood tests, usually almost all of us will be deficient in vitamin D3, so do get your blood test done, and we tell the athlete to have the vitamin D3 levels between 50 to 70 nanogram, not 30. 30 is for general population, and usually they are below 30, but we tell the athletes to maintain the levels between 50 to 70 for optimum performance. And obviously B12 is checked because B12 we get only from animal-based foods and not from plant-based foods. So if your athlete is vegan or vegetarian, we recommend a B12 supplement usually. Otherwise, for non-vegetarian athletes, they can get B12 from food itself, animal foods itself. Iron again is an issue. For iron, what happens is, although iron is available in foods, but iron absorption in the body is an issue for many people. Deworming pehle karna padta hai, and then giving the right sources of iron and increasing the iron absorption through combining foods. Like if I can give vitamin C or something which is acidic in nature combined with the iron-rich food, your iron absorption will be increased. So simple techniques like sprinkling lemon juice on your food, on your pulse curry or on your poha or on your some sabji which has iron thing can improve your iron absorption in the body. So simple techniques we do tell the athlete to have. Another, this is again very promising components, nutrients we can say. Omega-3 fatty acids, which are healthy fats, you get it from fatty fish, or from vegetarian sources you get it from nuts, especially walnuts and chia seeds, or you can have it from flax seeds also. So omega-3, we call it like a brain armor. Omega-3 fats are used for various purposes in the body, but for brain also it helps in especially the EPA and DHA, if you know. It helps in brain development and cognition health. So we do give omega-3 supplements if they are not consuming enough of omega-3 from the food sources. Omega-3 supplements are given. Polyphenol-rich foods, when I talk about polyphenol, it is basically bioactive components other than your nutrients, other than your carbohydrates, proteins, fats, vitamins and minerals. Polyphenols are something like pigments, color pigments. One of them are color pigments like your purple color vegetables and fruits, yellow and orange color vegetables and fruits. They have beta-carotene, anthocyanins. All these act as antioxidants and anti-inflammatory components which help to protect oxidative damage happening in your body. So again, this is not a foolproof. So instead of giving supplementation, we do try to incorporate a lot of colorful vegetables and fruits in the athlete's diet, so they get all these polyphenolic rich compounds from there. Yes, and we do get polyphenols from cocoa and tea, but we don't recommend tea more often. But chocolate, yes, dark chocolate beyond 70% which has cocoa in it, we can tell them to have like a one small finger piece in that. Hydration, again important. Dehydration, even dehydration of 2%, 3% can lead to decrease of 20 to 20% of performance. So that is important. Again, overhydration, drinking too much of plain water, not recommended. It can go to hyponatremia, which is low sodium levels in the blood. So again, not recommended. Some supplements I would like to touch base here on. Creatine, again promising, has a lot of benefits, well-researched supplement in the field, even in clinical and even in sports nutrition. Creatine monohydrate especially, around 3 to 5 grams, has also an effect on cognitive health. Caffeine, now caffeine does help in improving attention accuracy, but there are again side effects of caffeine usually if they take higher doses. In terms of, there is a gene also in the body. Some people are fast metabolizers of caffeine, some people are slow metabolizers of caffeine. So we also need to ask the athletes whether if they can drink coffee and still sleep at night or not. So if that is a criteria, we usually tell the athletes, if you can't sleep at night, you can't take caffeine or caffeine supplements during the evening training or during evening events. So that is a how psychologists, psychiatrists and nutritionists can work together. So yes, you can ask simple questions which I have mentioned here to them when they come to you. We also ask, how they are. So when we ask the athletes, we also have few questions like, how is your mood like? Do you feel anxious before your competitive events or before your training? How much pressure do you take? So even if, psychologists or psychiatrists, if they can ask about food when they're asking about their mood and everything. So I can, most of the symptoms can be covered with food itself. So yes, and just a quick thing about nutritionists or sports nutritionists, it's not only directly what we give plans, the plans or the strategies are based on so many factors. We ask them about so many things and then the strategies given to them. The base is always about balanced diet, a holistic approach of all the food groups and hydration. And then sports specific nutrition is involved pre, during, post training events, what has to be eaten, how much has to be eaten, and a small tip is of supplements, sports supplements. Supplements are important, it's just we should know when to give, in what dosage, timing and how much period has to be given. So yes, that works. And last message, I think it's for everyone. So many WhatsApp forwards or social media is flooded with so many myths about food and nutrition. So I just want to say, no single food is a superfood or no single nutrient is a magic nutrient. You should have a wholesome diet, a balanced diet, and please consult professionals to tell you exactly what you need to eat and how much you need to eat to have an optimum body. Thank you so much.
Yeah, it was a wonderful lecture. As her name, it was a Apurva lecture or a unique lecture. She is right. We in psychiatry usually I don't get vitamin D levels done because as we know 9.9 out of 10 people are deficient. So what I will do the trick is for myself also. My birthday month and 1 month prior, I take 8 weeks of vitamin D in every year. So preventively we should take rather than do the testing because it's much costlier than taking the vitamin D. And yes, second point about iron, what she mentioned was very apt. I am doing a recent study by schizophrenia patients and comparing hemoglobin and iron levels. Hemoglobin is absolutely normal, 16 and all, but if you see the iron, they are much lower, and that's why they have a lot of these cognitive deficits or some negative symptoms of schizophrenia which is still pending. So yes, iron supplements are must. So these are the 2 take-home messages and we should know. Thank you very much. Thank you.
So the insights today will reflect how psychiatry, nutrition, physio, coaching and performance science develops.
Thank you for such an insightful session, Apurva ma'am. Now I would like to request Amar sir to kindly introduce Dr. Devika.
Hello. It's always nice to introduce psychiatrists. Dr. Devika is such a psychiatrist, Dr. Devika Sharad Patil. She is not only practicing psychiatry, but she is also active sports person. She is the founder of Swastha Mental Health Clinic in Nashik and with MD Psychiatry and Masters in Sports and Exercise Psychology from the UK. She blends the clinical expertise with deep understanding the mental health faced by the both athletes and adults. Her work spans both general psychiatry, women mental health and support athletes across such as shooting, cricket, badminton and triathlon, helping navigate performance pressure, emotional well-being and resilience. She is, while doing this, she is herself is an enduring athlete herself and she is represented India for Ironman 70.3. It's a world championship and best, she was the second fastest Indian female to complete all full Ironman. So Ironman means I think 42 kilometers running, then 100 kilometers cycling, 90 kilometers.
4 kilometers swimming, 180 kilometers cycling and 42 running.
Okay, 4 kilometers swimming, 180 kilometers cycling and 42 running. Give her a big applause. She is a such a great athlete and she is psychiatrist herself. We are proud of her. Please welcome her for her journey.
So, good morning everyone. Thank you for the lovely introduction. And as we saw previously in the 2 sessions, right? So here we are going to talk about what essentially is a multidisciplinary team. How does it work for an athlete, and eventually what is the role of a mental health professional, so be it sports psychiatrist or a sports psychologist within the team. So, a multidisciplinary team for an athlete is essentially a group of professionals that play different roles and cater to different needs of an athlete. So, we know that athletes basically face a lot of stressors. So, there is physical load that comes from the training, there is psychological load, that is basically the kind of pressure that they feel, the performance anxiety that they go through, selection pressure and everything else. And there's also social pressure, social load that comes from expectations that others keep from them, that comes from the media pressure or how they present themselves or carry themselves. So when we look at MDT, that essentially consists of professionals who take care of the physical performance. So that can include your strength and conditioning coaches, nutritionists, health and medical, so that includes sports medicine doctors, physicians, sports physiotherapists, scientists. So again, this is something that we might not really see in India besides only elite athletes or in high performance academies, but you also have scientists who work on the biomechanic aspects of athletes. Then you have the management team and the coaching group. So here, every professional caters to different needs of an athlete and hence they have a different role to play. So it's like the name of the presentation itself, that an professional sees an athlete through multiple lenses, and I think that is what is most important. So yes, why do athletes basically need MDT? So as we did see that they go through multiple level of stressors, right? And that is why no single profession can cater to every need of the athletes. So even as a mental health professional, let's say, if I look at the mental health aspect of an athlete, but I might definitely not be trained into the nutritional aspect, or I might not understand that, okay, what kind of training load does this athlete actually have, right? Because I might not understand the intricacies of it. So that is where you have to collaborate and communicate with other professionals as well. As mental health professionals, definitely the point of early detection is very important. Because we know that already there is a lot of stigma associated with mental health. So athletes and even professionals might be a little reluctant to reach out to you. So honestly, I have very rarely seen that an athlete in his own capacity has reached to me, saying that, listen, these are the issues that I'm facing, can you help me out? Most of the times it has been a referral through maybe some teammates, friends, families, coaches, right? So imagine that if the team surrounding the athlete is not very sensitized to the mental health of athlete, then how are they going to pick it up, right? So here's where early detection matters the most. So you have coaches who can observe that, okay, this player is not training consistently, or he has been absent from most of the training sessions, right? Or even if he comes for the training session, he doesn't seem motivated, he seems to be aloof. So changes in consistency, drop in performance, physiotherapist. So one of the very relevant topics here is recurrent injuries. So when we have an athlete who has an injury, doesn't really undergo recovery very well and still gets injured. So that tells a lot about why that athlete might not be going through the rehab properly, right? Is it some kind of pressure that he needs to come back, he needs to perform, or even things like stress fracture. So we know that most of the times overtraining drives stress fracture. And where does that overtraining come from? So we know that there's a strong psychological aspect to it, right? Strength and conditioning coaches, yes, most of the time, again, it might not only be the psychological aspect, but they do notice that, okay, suddenly the fatigue has increased. Suddenly the athlete is not able to recover, right? So that time you have to look at many aspects. So like Ms. Apurva mentioned that there can be a nutritional aspect to it. There can be the thing that, okay, the athlete is not able to recover properly, he is not sleeping well, okay? So this is also something that I can relate to, because when I prepare for my triathlon events, towards when the training gets intense, I also tend to face this kind of fatigue, which is not only physical but mental as well. So I do notice that, okay, my energy levels are not really enough, or I tend to feel very exhausted sometimes. So that is when I have to look at my own psychology. I have to look at, okay, am I eating enough? Am I sleeping enough? Sports nutritionist, yes, as Ms. Apurva previously mentioned us. Mental health professionals. Right, and as I said earlier, that athletes won't or may not most of the times disclose entirely or directly to you, right? So it's about picking up these subtle signs in their behavior. And also when a team works together, it also prevents mixed messaging. That means, let's say if I, as a sports psychiatrist, psychologist, if I give preference to the, holistic well-being of an athlete, but if the coach is someone who is building up the performance pressure or who is always driving the athlete to perform, then the athlete gets confused, right? So should I focus only on performance, or should I take care of my mental health when I know that, okay, I am in distress, right? So a team always, yes, it might not be possible that you are always physically meeting or, constantly communication, but whatever you are doing, even as a mental health professional, has to be communicated with the other members as well. Right, so the role of mental health professionals. So we know that the mental health continuum model basically says that mental health doesn't exist in binary. So it's not good mental health and bad mental health. There is a continuum, which we see that on the left side, there are mental health disorders. And then as you go towards the left, it shifts from disorder to symptoms to, occasional some psychological distress to good mental health, and eventually the peak performance or flow state, which is, again, we would call it a state of optimal well-being, state of self-optimization. So as a mental health professional, your role exists on this whole continuum. Certainly, as sports psychiatrists, I think somewhere our role might be limited to dealing with disorders, symptoms, and occasional distress. But definitely, sports psychologists are someone who could help you with the other side of the spectrum as well. So, as sports psychiatrists, definitely early detection is what we talked about. Diagnosis, assessment, evaluation, and management of various mental health disorders. And then, as you go towards the right, you also start dealing with how you maintain the well-being of that athlete. So once, let's say, if you notice that, okay, the athlete is recovering from the symptoms, then the focus shifts to, okay, fine, how can I help this individual integrate back into his training cycle, right? So let's say if somebody is suffering from depression and anxiety, and because of that, that athlete has to take a break or reduce his training load. Now, once the symptom resolution happens, how do you, one, psychoeducate the athlete about, okay, what this condition is, what you need to be careful about, what signs tell you that, okay, this might be a relapse. Second, how do you integrate or how do you help the athlete again to start his training? So even how do you prepare the athlete psychologically to face something that he might not have faced while he was in, right? Then you equip the athlete with various coping skills, time management, and then eventually, towards the right, as we see that, sports psychologists play a role where they basically focus on the performance enhancement through various skills, and a lot of work also goes on working with the cognition of athletes, because definitely they might carry some thought processes, some beliefs that might not be very helpful in their performance, and definitely it also helps you dealing with unhealthy emotions that athletes face in and out. So how do you go about the evaluation and assessment? So clinical interview, like it is, we go about normally in all of our patients, but here there are some points which differ from the normal assessment that we do. So one that includes athletic history. So here we have to remember that you're not only seeing the athlete or treating the athlete, but also the individual. So you need to know that, okay, where does this individual come from? Why did he get into sports? What drives him? So this also gives you an idea about, his motivational profile or what kind of goals, expectations this person has. Along with that, the training load. So which cycle of training is the athlete in? So you might have heard of terms like off-season, in-season, right, pre-season, which basically gives you a very good idea about, okay, what intensity of the training might be, what are the number of hours that the athlete is training in. So you need to know about this because many times physical conditions like overtraining or nutritional deficiencies does have behavioral and psychological manifestations as well. Besides that, yes, nutrition. So again, what kind of diet do you have? What is your intake? Are you working with someone? Right? The psychosocial history. Does the athlete have a support staff or does he have a good support system? Because again, that also tells you about what drives the athlete, right? And how that athlete generally is with others. So here, yes, sports specific load, injury. Also another important thing is in the next, let's say, few months or year, what kind of goals have you set? Or what kind of competitions are you going to play? Because that helps you in your management plan. That okay, how long do you want to maybe take a break, or what kind of things are you planning to do? Sometimes we might also use tools for screening, like PH29, GAD, athlete psychological strain questionnaire. So basically, some kind of questionnaires or instrument that might be specific to sports and athletes. Yes, coach's observation, physio, again very important. Because sometimes the other professionals might be able to tell you something that the athlete or the family might not be able to tell you, right? So many times when I deal with athletes and when I talk to their coaches, so yes, most of the coaches do give me an input that since a few weeks or something, he has not been able to take on the load that he previously used to. So again, that tells me a lot about what kind of impact are his psychological symptoms having on him, and roughly how much time will it take for him to come back and get integrated with the treatment. Confidentiality boundaries, very important, because even though we are working with teams, sometimes it does get tricky that what do you actually be and what do you not.
Sometimes it can be a very black and white scenario, but sometimes the line is very blurred. Because on one hand, you want to make sure that, okay, the information, the relevant information is being communicated, but at the same time, if the information is of such nature that can affect the athlete's relation with the other professional or his future, then you are in a phase. So how do sports psychiatrists can use their support? Okay. So during assessment and diagnosis, as we did see that input from various professionals does help. Differentiating clinical disorders from overtraining or pressure. So as I said that sometimes overtraining can also have psychological manifestations. During treatment, medication. So we do know that sometimes psychiatric medications tend to have side effects that can impair an athlete's performance. So this is also something that you have to look out for. On lines of this, one of the examples that I remember is a 30-year-old athlete, badminton player, who was diagnosed with depression and anxiety. So based on the severity of symptoms, he had to be started on SSRI and melatonin. But after a few weeks, even though there was improvement in his symptoms, we noticed that he was gaining a lot of weight. Again, the weight gain was something that was very fluctuating. So in, I think, a month and a half or something, he gained 10 kgs of weight. And according to him and his nutritionist, his diet, he was not overeating. He was, his appetite had increased definitely, but we felt that it didn't amount to a 10 kg increase. So that's where we started thinking that we started looking at various angles that what could be contributing to it. So he was on escitalopram, and we know that escitalopram is not one of the safest with regards to weight gain. So I still considered that, and I shifted into something which is something like fluoxetine, which is we know is on the very end of the spectrum in terms of weight gain. And as we investigated further, we also got to know that since a long time he had issues with acidity and peptic ulcers and everything. So he was referred to a sports medicine doctor, and on the investigation they found out that he had a polyp, which can be a reason for his weight gain and other GI issues. Now that is something which is being investigated, but this is just an example how you can work with different professionals and get to the common point. Risk management, again, very important, because definitely sometimes an athlete might feel very vulnerable to even report something which is very distressing. But sometimes it can be presented as somebody voicing suicidal ideas or very increased aggression or substance use, especially of banned substances. So that time, the other professionals should know that, okay, if an athlete is in crisis, then what should you do? Because they might not be in the capacity to help the athlete. So this is where the referral system comes into picture. That, okay, if I am a physiotherapist and if my athlete is reporting that he's been feeling suicidal, I should know whom to refer to, right? So that is safety nets, return to play decision. Again, one of the tricky areas that, again, as a psychiatrist, I might be sure that, okay, he's not in the state to compete for the next 1 month or 2 months. He's not ready to take on the pressure. But, again, if there is an important event coming up, then how do you make the decision to, should you play or not play? And if yes, what kind of goal should you set? So here, the collaboration with a sports psychologist, his coach comes into picture. Performance enhancement, so whenever, let's say, I teach an athlete any kind of mental skills training, so be it imagery, breathing, pre-performance routine, so it never works in isolation. It doesn't work if the athlete does it for a few days and stops it. So it has to be integrated in the training, right? And especially with young athletes, you can very well tell the coach or the parent that, okay, this is what we'll be working on, and these are the techniques that he has been taught. So, please make sure that he does it. Athlete transition, again, when any kind of transition happens, so how do you support the athlete psychologically? And we have to end the session here. Yeah, just 2 minutes. So communication and collaboration. So as I said that the message that you are giving out to the athlete has to be the same, which comes from having a shared value, language, early reference, like we saw, athlete-centered decision making. So I think the most important part is whichever professional you are, your decision should be centered around the athlete and the well-being of the athlete and confidentiality. Yeah. Thank you.
One question I'll ask. If these ultra marathoners like you, how you maintain your mind in this long period? Because it must be very boredom.
So I think over the years it has changed, because I remember earlier when I started doing it, I used to get a lot of thoughts that okay, kaise hoga, will I be able to do it and this and that. But I think over the years I have noticed a shift in my own mindset. So most of the times now when I swim, run, cycle, my mind is just blank. It's just blank. I don't have any kind of thoughts. Yes, there are a few things that go through in my mind that okay, after 30 minutes I need to have my gels, I need to hydrate, and okay, 10 kilometers go ahead, 50 kilometers go ahead, things like that. But I think besides that, it's just a meditative state I think I enter into, which keeps me grounded. And bore the newness. Because I keep playing music in my head.
Yeah, great. Thank you. Thank you for the good lecture and good insight.
ट्रायथलॉन, आयरनमैन, ये सब कुछ मैंने कर लिया है। तो मैम को देख के मुझे बहुत बड़ी इंस्पिरेशन आ रही है। लोगों के व्हाट्सएप लास्ट सीन सुबह 10 बजे, शाम 4 बजे, 2 घंटा पहले, 15 मिनट पहले मेरा वैसा जिम का है। लास्ट सीन 15 डेज बैक, लास्ट सीन 30 डेज बैक। जिम में जाता हूँ तब कुछ पूछता है सर कहाँ से कब मेंबरशिप रिन्यू करने आया हूँ। सर अब आए कब थे? आया ना 20 दिन पहले। तो जोक्स अपार्ट, लेकिन मुझे बहुत बड़ी इंस्पिरेशन मिल चुकी है। मेरा वजन जो है हनुमान जी की पूंछ की तरफ बढ़ते जा रहा है। तो मैंने सोचा है कि मैं जिम स्टार्ट कर रहा हूँ। सॉरी यस एंड सॉरी सर। ठीक है, आज संडे, कल इसके बारे में सोचेंगे। फिलहाल एंट्री गूगल टी में।
While we are at it, I would like to thank one of our sponsors, Indas, for sponsoring this conference. And as we move on to the next speaker, I would. Am I audible? Yeah. I would like to request Dronacharya sir to kindly introduce Jagruti sir.
The questions are asked कि आप इतना सब करते हैं, स्पोर्ट्स भी करते हैं, ट्रायथलॉन भी करते हैं, तो how it is possible? So the answer is our next speaker, Mr. Jagruti Sethi ji, because he is the strength and conditioning coach. So I think he is the best person to answer these queries. We welcome you, sir. He has an interest in sports. He himself is a sports person with experience of more than 10 years. If I read the CV, he is a क्या स्पोर्ट्स छोड़ा नहीं सर आपने? फुटबॉल भी रखा है, हॉकी भी प्लेयर एंड ए सीनियर नेशनल पावर लिफ्टर. So please, all of you have to behave yourself in these lectures. He is a power lifter. We welcome you, sir.
Good morning everyone. So my name is Jagruti Sethi and I'm a senior strength and conditioning coach. So before even I start speaking, I just have to ask 3 questions. अगर मैं कुछ पूछूंगा आप खाली हाथ उठाना है. आपको विराट कोहली पता है? Rohit Sharma, Cristiano Ronaldo, आशा लता देवी, किसी को पता? हेलो, ओके, आशा लता देवी, anyone knows her? आपके पास फोन है तो आप गूगल कर सकते हो. You can just, I'll give you 10 seconds. You can see who she is. Anyone, like, if possible. Ma'am, you can also. Asha Lata Devi. She is the captain of the Indian women's football team. So the reason for this is that SNC is not just for men; it is for women as well. So we should be in touch with the football scenario as well in the women's team. So as you can see, the coaches at OAP, so these are the coaches, we all are ex-athletes, cricketers, badminton, footballers, everyone. So the person on the extreme right, that is Sumit Jaiswal. He is the founder of OAP and he is currently the SNC for the Mumbai Ranji team, that over here, like, of MCL. So yeah, we understand the sport, we understand the psychology behind, winning and losing competitions. So we are in a better position to train athletes. So the concept of SNC and athlete wellness. So the first point that shows is stronger bodies and healthy athletes. If an athlete is stronger, not necessarily he is healthy, but if an athlete is focusing on his health and then getting stronger, it is the correct way to go with. SNC is the foundation of athlete wellness. It is not just physical wellness, it is the mental wellness as well. Because if the mind is not working and the athlete is just performing, without any concern of his mental health, definitely there will be a burnout stage where you see he's winning but he's not happy. He's just training every day, 365 days, but he's not happy. He's not content with himself. Definitely it reduces the risk of injury with training. Customized training programs, all the names that I took, Virat Kohli, Rohit Sharma, Asha Lata Devi, they all are different personalities. So the training programs have to be different for each one of them. And yes, we want to achieve peak performance of all the athletes. So how do we go about it at OAP, at 1A Performance? So the first thing that we do is assessments. So assessments are not just, writing notes about the training, competition. It is actually I'll go to the next slide. It is assessments of all these tests. So there are strength, power, agility, speed, cardiorespiratory, flexibility tests. So these are health specific as well as sport specific tests. So we as an SNC definitely we want the athlete to be good in their sports, but we also take care of their health. So health is a priority when it comes to athletes, because if an athlete isn't healthy, he's not going to perform. Because if health, let's say for example the fifth test, that is the cardiorespiratory system test. If that is not good, he cannot do conditioning. Like if you can see outside, it's hot and humid. They are playing cricket over there. So it's difficult to even survive for 30 minutes in this heat if his cardio health is not good. So all the tests play a crucial role in the athlete's assessments. And the second part, we ask the athletes are the weak links. Let's say Virat Kohli, he might be superbly fit. He can run probably for 90 minutes continuously. But let's say there is another person like a Virendra Sehwag. He doesn't like to run that much. He is more of a power hitter. So his strength is power. Virat Kohli's strength is running. So we have to be very sure what is the weak link of that individual athlete. And then we go to programming. Let's say like there are many people around here. So each one will be doing different exercises, not just back, shoulder, tricep, everything, but it is individualized. So everyone has to perform, and the exercise has to be chosen by the SNC accordingly. And the fourth part is the reassessments. In January we do the testing. Let's say for example, after 4 to 6 weeks we again do the reassessments to see where the athlete stands after 4-6 weeks. So one of the examples, a report is of an athlete. I've just got it. So all the green markers shows improvements. All the red markers are basically still can be improved, or because one of the reasons might be he might be fatigued, mentally strained because of competition, or many reasons. So this is just an example of how a report looks like from an SNC's point of view. And another crucial aspect for us is the load management of an athlete. So we play a very important role with this part when it comes to physiotherapists and us. So we work in sync with this particular thing over here and the head coach. So if you see, there's a ratio between 0.8 to 1.3 where we want to keep the athletes as a sweet spot. If it is under that, the athlete is an under training phase, and if it is above that, it is a danger zone. Basically, athlete might go towards a burnout state where he might not be able to sustain for that long. So it's called as ACWR. It's an acute to chronic workload ratio. Acute is for 2 to 7 days, and chronic is between few weeks to months. So the load that I'm saying can be internal load or an external load. Where I'm speaking in front of you, the heart rate is increasing, the RPE for the session is different for everyone, the wellness questionnaire. And the external load might be the easier part for me as an SNC, the volume, intensity, the load lifted, speed, power. But the internal load and the external load, they together combine and form the entire load for the athlete. So that 0.8 to 1.3 is my role, the role of a head coach and the physio. So that he isn't in the burnout stage. So this is an example of a load monitoring of an athlete. So if you can see the green part, it's basically between the sweet spot. But the red part over there is where we see an overtraining phase. And basically there can be multiple reasons for that. Might be overtraining due to fever or anything. And at OAP, at One in Performance, we definitely use a few of technology that we have. So the first one that where an athlete is running is basically a timing gate. It is used during the field test for speed and agility test. The second on the right hand side below that, it is a VBT device. It is a velocity based training device where we track each repetition for how much power it is being lifted at. And the second one on the left side is a jump mat. It is used during the power assessments at One in Performance. So yes, this is just a basic idea of an SNC, what we exactly do at with the athletes. So it is not gender biased. It is for everyone, and it is not just a gym training that we do. It is the back end as well that we do. So yeah, this is a basic idea of an SNC that we do. It is an entire day for us, all this. So yeah, I wanted to keep it short, not too long. So if there's anything that I can help you with, I'll be glad to do that.
So it was an excellent crisp talk, and you gave an overview of what all you will do in the field of sports psychiatry. This was a unique concept of the CMU because we had a multidisciplinary team. Because for us, sports psychiatry is हमको क्या रहता है कोई तो काउंसलर होगी जो उसको कुछ बातें कर करके बहुत कुछ बताता रहेगा. But now we know there are multiple disciplinary teams, right from the conditioning coach, from the nutritionist to the aquatherapist and the physiotherapist, and there are the psychiatrists and the psychologists. So hats off to Dr. Amar Shinde sir to coordinate this and organize this CME, and Mansi Vora also. So over to the anchors of the day. Thank you.
One or two questions for please. Name, your name and
My name is Dr. Geeta Chouhan. I wanted to ask how do you measure that sweet spot and danger zone?
So basically we have a group. So I could hear you. We do the RP. It's according to the athlete's RP and the wellness questionnaire that we have. So if you see this particular part and the internal load, the external load we can calculate through the devices that we have, but the internal load, if you see, the RP is the major one that we use on a scale of 0 to 10, how hard was the session and everything. So they put in the load in the software, we get the report like this. We get a weekly report like this.
nice sir. Name and
Hi, I'm Dr. Sujay Kulkarni. I've been a runner. I've ran marathons. I've met Devika during a triathlon. And so one question I wanted to ask, I've seen a lot of young athletes wearing all the smart watches, and they calculate their timings, the calories they take, sometimes VO2 max, VO2 by heart rate. There are so many gadgets over there. So somewhere I have this thing that too many gadgets increase the performance anxiety. And if we flow with like Devika said, I keep my mind blank during running or during swimming. So the more blank the mind is, the better it is. What is your opinion on that?
I definitely agree with you on this, because particular watch I'm wearing, it's been there with me since you can hear me? It's been there with me since 10 to 12 years now. I wear the same watch everywhere. So the only thing that is constant is the time. Heart rate monitors are good, the watches and everything, I agree, but the main thing is the watch, the timing thing. Heart rate monitors, yes, definitely. The other things definitely increase the anxiety and the nervous system shoots up like crazy in the first kilometer itself. People who do Ironman, they might agree with this. I agree with you on this. So we keep it very simple when it comes to the tech.
Hello. Any question to Dr. Chandni, Ms. Apurva?
In one of the slides you said that indicates that how is their mental health and green indicates that how they are performing well. So how do you measure that exactly? See, individual athlete, they have a good health and every indicators which you have. How do you measure that for each and every individual? Like you said, for Virat Kohli something different, and for Virat, everyone has different expertise. So how do you measure that exactly?
So for example, let's say I speak about, I'll go to that. Let's say take example of this particular athlete. We know him, he's a tennis player. So let's say for him, speed and agility are crucial. And his game lasts for around 2-3 hours also. So his base is aerobic endurance. So if endurance is bad for this athlete, so the thing that I was saying is it is specific to the athlete, it is also specific to the sport and the position that they play. So if, for example, if a goalkeeper of a football team, he doesn't need to, aerobic endurance is required, but not that of importance as a striker. A striker has to run for 90 minutes. But for a goalkeeper, he needs more of those jumping abilities and everything to grab the ball. So this is the difference between a position specific and a sport specific demand. So this is this one. Thank you so much.
Thank you for such a wonderful talk, all the speakers of this session. Now, I believe my co-anchor has something funny to say.
या सारी बातों को देख के कुछ लाइनें याद आ जाती हैं. ना हारना जरूरी, ना जीतना जरूरी. ना हारना जरूरी, ना जीतना जरूरी. ये जिंदगी एक खेल है, इसे बस खेलना है जरूरी. थैंक यू.
Definitely not funny, very insightful, my bad. Now I would like to request Dronacharya sir and Amar Shinde sir to please come on the stage to felicitate all the speakers. Okay. I would like to first request Dr. Chandni Mehta ma'am to come on the stage.
एक मिनट क्या रह गया
Please give them a big hand.
Thank you.
अब मैं बुलाना चाहूँगा मिस अपूर्वा सुर्वे जी को और मिस्टर जगरूति सेठी जी को. Kindly come on stage.
Yes, also Dr. Devika Patil, while we are at it. Please. Now I would like to request chairpersons. Yes. Now I would like to request Dr. Ravindra Kamath sir to please come on the stage and felicitate our chairpersons.
Look at the camera, sir. Smile. Thank you.
Thank you, sir.
Please give our chairpersons a big hand. So we have a slight change in the schedule. We're going ahead with our next talk on mind-body interactions with case vignettes, mind, body and performance. Today's sessions are proving that you can't separate one from the other. So, yeah. For that, I would like to request Dr. Rukshida Saida ma'am and Dr. Shobha Nair ma'am to please come on the stage. They are our chairpersons for this talk.
Welcome, Dr. Rukshida Saida ma'am. Let me introduce about her. She is a founder of Release Family Center, located at Lokhandwala, Mumbai. She is specialized in adolescent, young adults, women, and families counseling. Along with that, she is a vice president of Indian Association of Biological Psychiatry. She is a chairperson in women and mental health, subdivision of mental health in Indian Psychiatric Society. Also, she is an ACT member of Indian Association of Private Psychiatry. She is working as an advisor led by Foundation Family First Guidance Center, and along with that, she is in the chair for what we pronounced. I think we should ask you, ma'am. What is it that?
Listen, don't read that out. Just say very nice, glowing things about me and we are done.
Okay. Okay. So she has studied her MBBS from LTMC College and Children's Hospital, Science Mumbai. Along with, she completed her psychiatric training at GS Medical College and KM Hospital, Mumbai. She has done her WHO fellowship in a psychosocial rehabilitation center in Yonggi, South Korea. And she is author of origin and review articles, chapter contributions in textbook, media expert and TED speaker.
The next chairperson for today is Dr. Shobha Nair ma'am. Who's the head of the Department of Psychiatry at VRC Hospital, Mumbai. She's had 28 years of clinical experience. She's a postgraduate teacher and guide for DNB Psychiatry. She's the current president of Bombay Psychiatric Society, past lecturer at Nair Hospital, Mumbai. She's done her PG from Nair Hospital and UG from KM Hospital. And we welcome both of you, ma'am. Okay. Now I would like to request Shudha ma'am to please introduce our next speaker.
I don't have a mic. Okay, that's fine. No, that's perfectly fine.
Good morning, everyone. Thank you so much for being here today. Sports psychiatry is still in its nascency, but it's really important. Precisely because of that, it's really important for all of us to show support and love and encouragement for it. So it's an honor for me to share the dais today with the current BPS president. She doesn't come out very often unless and until it's really close to her heart. So you know that this is an important session. So thank you so much to the organizers for having me here on this important session with such a luminary of our psychiatry world. It's also a pleasure to introduce Dr. Trisha Parekh. She's a sports medicine specialist. She's attached to Reliance Hospital. Just because she was invited here, we know she's the perfect person to share about sports medicine that we as psychiatrists or mental health professionals don't really see on a daily basis. She's got numerous awards, including the Olympics 2024, the Chief Medical Officer for Team India and the Paris Olympics, appointed by the Indian Olympic Association, consultant for Indian Super League, many elite athletes and sports academies across India. I'm not wearing my chashma, so I'm not going to be able to read out every little thing, but trust me, she's somebody that we all want to sit down and pay attention to if we are interested in learning more about sports and our athletes, whether we, especially if they're in competitive fields, but even if those of us who may be amateurish at whatever we are doing. So with this, I'm going to hand over the mic to Dr. Chouhan to share a few words on the topic itself.
Thank you so much, Ruchira. And thank you for your kind words. It's nice to be co-chairing with you. So, thank you organizers for having me here. And I think we heard a little about the mind-body connection a little while ago. So, the interesting part of the current lecture would be that it is case-based vignettes are there. That will give us a lot more insights. And I have heard from some of my marathoner friends, who initially started running, that the last few kilometers is just the mind. If you are just focusing on just completing it, it's like every muscle is fatigued. You feel that you may not be able to run anymore. There will be thoughts that let me just stop this and not go to the finish line. So there are people who have told how the mind just overcomes these thoughts and then you just make it. So I think we would be listening a little about probably the neurobiology of the mind-body connection, or how the mind, I do not know what you would be talking about. Extremely curious and enthusiastic to listen to your talk.
So good morning everyone. Thank you all for being here Sunday morning, and thank you for inviting me, Dr. Mansi Vora and the association, and thank you for the introduction. To add to Dr. Chouhan, I'm Nairite as well, and I definitely do remember learning whatever few clinics we did attend in psychiatry, so I definitely remember doing that to you. So going on to my talk, when we talk of sports medicine, what are the things that is striking people? I think Shobha has already given a little bit more insight to what I'm going to say, but basically what strikes people is an injured athlete, and in the Indian scenario it will definitely be a cricketer lying on the field with an injury. Now, runners, yes, the marathon is a very big thing. We would think of a marathoner who's probably feeling a little sick at some point at the race. However, sports medicine is also about not just about injuries and about marathons. It's about everyone, anybody who wants to do exercise, and the cases and the complaints could be anything from a simple tiredness which comes about with exercise. So basically sports medicine would be any complaint related to exercise. And the exercise could be a simple walk in the garden to a trek, to a high altitude trek, and any and everything which comes along with it. So the medical complaints that come along with something like that, as well as the preparation which goes along with something like this. So basically sports medicine would be treating an athlete to enable him to successfully be playing or returning to his sport. Now a couple of things in this small little sentence. When we say treating, the treatment as a sports medicine physician and a sports science team along with it is quite vast. So the previous speakers, the panel that you heard in the morning, so that's pretty much a sports science panel as well. It's a sports science team. We are all part of a sports and exercise science team. We all almost have to work together for almost all cases, or at least few people for a lot of cases. So the treatment goals are everything from if it's an injury to treating the basic injury, to looking at the person's nutrition while they are injured, to looking at, that's where the mental health comes in. Anybody in this audience who has had a decently big injury or a surgery, putting you out for about a week's time? Anybody? So how was it when you were injured or you had the surgery? You are a practicing psychiatrist, I understand? Okay, yeah, please go ahead.
I just fractured my ankle in August.
Mm-hmm.
And it's been a struggle. So I'm barely walking. So it's a daily thing when you're doing physio to be like, oh my god, I'm doing my foot.
So that's the physical part of it. How else? Are you getting to work? Are you going to work? Okay. You've been going since day one?
No, I've been working like modified.
Okay. So modified work. So that's where we consider in sports medicine every person as an athlete, because the athlete's job is his job, which is to return to play. But you are also an athlete, a high-performing person, wherein if you cannot return to your work or you are doing a modified work, it is affecting you at some point physically, monetarily probably, and all of that together brings about a psychological thing. I think a lot of it came out a lot during COVID, when we were talking of the long COVID and all of that. The recovery from COVID had a huge mental aspect. Forget the being in the lockdown part, but all of that also had a huge mental aspect. So the treating of an athlete is encompassing all of this. And now that it sounded like you also do some exercise, like on a regular basis. Your previous question, I think I understood. The previous
Just doing just the contrast between how basic the physio is versus what one could do before.
But do you do any regular physical exercise, like gymming or running or
walking? I used to earlier. Now I can just about walk.
Because of the injury you stopped. So again, now you were doing something. Now because of the injury, you what we call detraining. Okay. So again, detraining happens in everyone. So whether it's an athlete or a normal person, that detraining is only again going to happen, and that's where the SNCs come into picture. The physios and the SNC combination comes into picture. That will get you back. Very important when somebody's getting back from a detraining period. You don't start where you stop. You probably start from a little more baseline. So all of that is the treatment which comes about of an athlete to return to his sport. And like we said, like I just mentioned, it's not just an athlete we are talking about. All of these are athletes in their own capacity. Okay, a nurse or a doctor doing long hours in the hospital, it's equally arduous. Funny enough, we did I work at HL Reliance Hospital, and I think it was some day, and we organized exercise test in our department for all the staff. And we did a simple calf raise test, like how many calf raises can somebody do. And the norms are some somewhere in like the 2-digit number, you know, variable, but if you do single leg, it's like a 20, 30, depending on age and all, it differs. We had our nurses who went on for more than 1,000 reps. It was crazy. Till the time that the person, my staff who was counting, they had to change hands. They were like, "Abhi main nahi gin raha hu, abhi tu gin," because we are tired of counting. But those ladies did not stop. Okay, there are these tiny little girls who are nurses, and they just kept doing this. They just kept going on and on. And some of our department staff got very enthused. They were like, "Okay, if they are doing it, we'll also do." Next day, everybody was like this in the department, and these ladies, I'm pretty sure, were up and about their work. So I think everyone is an athlete in their own capacity. Imagine this nurse gets an injury, she has to take off work. So the aim of a sports medicine physician is to basically get any one of these persons back to their job as quickly as possible. Same with the mother. Nobody, if there's any mother in the audience, you don't need to explain how crucial your role is. And same for a businessman. This is not from the recent Indigo picture. Okay, it's just a picture of a businessman who needs to get to his work, or who is just doing multiple flights and travels, and you know, every time if he's got an injury, if he's suffering from something, it's a backlog for him. Mentally also it becomes a backlog that, oh, I can't do this, I can't go for this because I'm having an injury. So all of that affects him mentally as well. So that was a little bit about the treating part. And training part, like our previous speaker also nicely mentioned, scientifically training the athlete to improve performance, again without sustaining injury and ill health. Again, this is for athletes, but it's also for the common people. Now we just have our base of the pyramid of people who are exercising is, you know, elite athletes and Olympians who we see is just the tip of the pyramid. The number who is doing, you know, just regular exercise and marathons, that the base of the pyramid is just too vast. And all of these people are doing the running and all as their second profession or second passion. It's a passion. They all have a primary day job, and they all do this running as a secondary thing. So compared to the elite athlete, according to me, these guys are at a bigger risk, they are at bigger danger, because if the athlete is sick, he can just sit in his room and gym and just keep doing exercises in rehab. But this guy, if he's injured, he has to come for physio, but he still has to report to his day job. So that stress which gets added on, and we literally see this on a daily basis, because that's the majority of patients I see in the hospital. People who are not just elite athletes, but they are elite in their day job as well on the profession. So that's where, you know, just summing up what sports medicine really is. So it's the scientific and medical help for anybody who is physically active, wants to be active as well, and who would benefit from activity. When I talk about this last section, would benefit from activity, it's those people who are sedentary, who probably have metabolic disease or some other problems, and some physical activity would actually benefit them, and now we call it like the fourth vital parameter of checking, you know, checking with the patient that in addition to your basic parameters, are you also adding on some physical activity? So that's where that is. And the aim of sports medicine is to develop and deploy treatment modality with minimal morbidity, quickest recovery and fullest rehabilitation to normal state of individual. And now this last term of fullest rehabilitation, that's where I would like to introduce the mind-body connection, because that's a big thing with the mind and body. So we are talking physical recovery, which is rest, rehabilitation and physical therapy, mental recovery, addressing the fear, frustration, anxiety related to injury and illness, okay? So fear of re-injury is massive, okay? People who don't return back to sport, what if I get it again, okay? And because of that, they are not doing exercise, that's massive. Frustration, like I said, it's not always easy, rehab, you know? We say that rehab should be like this, like you should keep improving, but the fact is, it's like this, you know? There may be one bad day with every few good days, and that, depending on the person's mental psyche, somebody takes it nicely, somebody gets frustrated. Anxiety, again, related to the injury, illness. This happens a lot in our Indian scenario, because very often a lot of things are monetarily driven as well. Even for our athletes, if they don't perform at a particular thing, because a lot of our athletes are, they have a job with the government. They perform for the railways and, some organization. So if they don't perform well, then that monetary aspect goes away for them. And holistic approach, treating both mind and body for effective and lasting recovery. So now I'll come to my first case. This was a girl years ago. 21-year-old female, resident of India, but studying in UK, and she was on the swimming team, and she's been swimming since the age of 9 years. She was referred to me for tiredness and breathlessness during exercise. She had already consulted a pulmonologist, because that would be the standard thing, right? If you're having breathlessness, you probably go see a pulmonologist. And she was on some treatment with that. But she continued to have the breathlessness, and then the mother also complained that she's having panic attacks. So the breathlessness part is what, she had a mild asthma and that was being taken care of, but she was still not out of her breathlessness in spite of the treatment, and she was not having good relief, and she was not performing. So it was because of the performance aspect that they landed up with me as a sports medicine physician. Detailed analysis of this case, basically we also repeated so we look at the medical part where we say, okay, yes, medically these things are required, but then went deep into the full history. And over the years, the interventions that we've done, mind you, this has been over the years because it kind of almost took 1 year to get this girl out of everything. We actually reduced her swimming training. For anybody who's into swimming or knows who has swimmers, swimming in India or abroad is very, 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 very rigorous for some reason. The training involved with swimming is very rigorous. They are doing multiple hours throughout the day. So that is not something that everybody can manage, okay? So we had to reduce our swimming training, reduce expectations, okay? I think as psychiatrists, you all probably talk about this to your patients very often, and there are some psychologists. So same thing had to be done with her swimming expectations. Reduced competitions, because we figured during the talk that it was actually the competitions where her panic attacks were coming in most. She got on to regular psychology sessions, putting her to the right psychologist for this purpose, that she was earlier with a clinical psychologist. We kind of shifted it a little bit to a sports psychologist because we figured that a lot was around swimming. It was to do with her coach having preferences for some other girls compared to her and things like that. Slowly, she weaned off the medications. When I'm talking medications, she had not gone to the point of taking psychiatry medications, but her pulmonology medications actually decreased because the breathlessness ultimately came into control. And then, because we don't want to stop physical activity, we ultimately suggested her alternative physical activity, which could be more enjoyable. And today the mother is still in touch with me. The girl has zero breathlessness. She has discontinued competitions. She swims for leisure only now. She's discontinued swimming as a profession. She's taken up other sports and she's studied and achieved more academically, which she finds more gratifying. So, it doesn't always have to be that the person needs to go back to what they were doing. Ultimately, you have to be happy and comfortable in life. Today, the mom and the daughter are both super comfortable. They were like, fine, we gave swimming, 8 years of our life. It didn't work out, okay? We enjoyed it for that little bit. But today, she says the mother is herself a yoga teacher, and she actually, I think, took up yoga following when she saw her daughter going through all this, and then now she's become a certified yoga teacher. And she said, I'm very happy because the zone in which she is now, she's a happy child. Somewhere during the whole swimming thing, she was doing brilliantly, she was doing academically brilliantly, but those panic attacks and all were taking everything joy out of our lives. So now she is happy today. So that was one thing I wanted to highlight, that it's not always getting back into your sport or anything. Such a slightly different route can happen as well. And so that's where my sports physician's consult was, the assessment is global rather than focal. Even the complaint is focal. So in our sports medicine, we have an entire chapter on breathlessness in sport. So I could have gone on to, in detail, looking at more parameters and how to assess a breathlessness in more detail. But looking at the whole global perspective was more important. Identification of the most positive factor and the most modifiable for a better health. We have so many patients who come and tell us that, oh, you know, I have this particular thing in my foot, but it's hereditary. Everybody has it. So now what can be done? One, you know, there may be misunderstanding that something is hereditary. It may not always be hereditary. But if the person has accepted it, then we move beyond it. We say, okay, if you accepted that it's hereditary, you are happy to go beyond it, then let's find something which is more modifiable. And let's treat that. Physical activity and exercise science knowledge is very important for a sports physician, and that is where we come in, that we've got the knowledge of a doctor, but we also understand the exercise physiology, and that's where we combine the two and give that to the patient, that you know, this interaction, how it works. And also understanding the psychology of an athlete and an exerciser and a non-exerciser requiring exercise. So understanding the psychology of an athlete is super important, because you cannot, we get a lot of people who come with prescriptions that, you know, I'm a runner, I had knee pain, foot pain, and XYZ doctor advised me that I stop running. But that doesn't work with them, because running for those type A, semi-type A personalities is something that they just want to do. So we have to modify things for them, so that we need to understand that psychology. So I may not understand the psychology in detail like the sports psychology, but one thing I understand is, if I tell this guy that, yeah, you don't run and you be in bed for 5 days and you'll be fine, one, he's not going to improve because he's not going to stop running. Okay? So he's never going to come back to me, because he'll say that this doctor just prescribed something quite silly. And I know he's not going to stop running, because that's a guarantee. They don't stop running, they don't stop doing their exercise. Something very hard has to be put onto somebody who likes doing exercise to tell them don't do exercise. So we have to understand that, modify things for them, and then give it to them in an acceptable way. The next is the non-exerciser category. Okay? A patient's coming, obese, diabetic, you know, full metabolic syndrome. Doctor say, हाँ ये सब दवाई और कल से 30 minutes walking चालू करो. It doesn't work like that for at least 50% of the people. Okay, they don't just start walking like that, because that's the psychology of a non-exerciser. Okay, they need to be really convinced as to how investing those 30 minutes is going to be a game changer for their entire health. So again, we would not understand the full psychology, but as part of our team, we run a particular program called Transform, wherein we have these aggressive guys and we have the obese. We have both of them, and we work with a mental health coach, because that person needs to understand that what is driving this person to do something or not do something, and that really needs to be targeted. Otherwise, the nutrition program doesn't work. People don't take medicines. We know that, you know, if they are not convinced, they will not even take the medicine. So we need to understand, and that's why the whole mind-body connection and the mind part is so important, that the person needs to be convinced this will work and he should employ it. Just yesterday, there was a 65-year-old who came with some complaints, and he's like, oh, at the end of the consult, he's like, you know, I'm going to send my son also to you. And he's like, you know, but I'll let you know that he's a little difficult character, XYZ, XYZ. I said, you know, what is your plan? Like, what are you going to tell your son to come to me? He's like, no, he does Muay Thai, and, you know, he's got messed up in his certain joints, etc. I said, when you're going to say that, you know, go to this doctor, you know, will he come? He's like, I hope he comes. I said, my suggestion, let him see you getting better. Okay, let him then come and ask you that, Dad, what are you doing that this complaint you've been having for 6 months has gotten better? I said, you know, he's already seen 5 other physios and doctors before. So for him, I'm just going to be another person whom he comes to. So let him get convinced, because that is very important. Otherwise, it's just another opinion that we all know that everybody keeps taking. And they're like, okay, you know, we shocked. So it should not just be a shocking thing. They should be convinced that, okay, I will probably get something, and they should then follow the advice. Because people ask us which is the best exercise, which is the best advice. I think I always say the exercise that you do consistently is the best exercise, which you can do consistently. And the advice that you will follow will be the best advice. Because if you don't follow even the best advice, then you know nothing. You can send your kid to the best of the classes. The kid is not going to study, he is not going to get the marks and whatever we want. Okay, so that's exactly where this is. I think I've explained a little bit of the mind-body connection. The second part of mind-body connection is that a positive mental state can enhance physical performance, while mental stress can hinder it. We all know that. I've mentioned about the job issues, stress, anxiety, which comes with non-performance and the job getting affected. And lastly, motivation, focus, and emotional well-being are essential for recovery and peak performance. This was from the Paris Olympics. This was the first time that the Paris Olympics, which was in 2024, had an entire mental health space, and it was amazing. I was there at the Olympics, and that was really amazing. We can see her, one of the gymnasts from US, Simone Biles. She was captured, I think, multiple times, sitting on the sidelines and doing various, various activities which had been mental health, various relaxation activities which had been taught by her mental health team. This was a very nice thing in the mental health safe zone. So it was called Safe Sports Zone, where they had everything from coloring. They had a lot of AI things where you just sit and listen. So everything from mindfulness and all, but it was all guided. So AI guided mindfulness and also they had multiple things. And it was besides the athletes, people like us, doctors who were there for 1 month inside a village. You can call it a bubble in itself. It was quite useful because it was kind of useful to take us away from the work and put us over there. So it was a very useful thing that was done. Second athlete that I want to talk about in sync with the Olympics is an international athlete with night terrors. So athlete, we always say, is a human first. Okay, so just because they are an athlete, it's not that they will be devoid of all of those normal things which happen to the normal humans. So this was a 21-year-old female with panic attacks again, but they were specifically at night. Working with psychologists already on her sleep. However, it was only after multiple sessions that some childhood trauma which was triggered by events came off. And in this particular situation, it was assessed that she requires psychiatric medication as well, along with everything else that is going on. So that is where this thing, and she's, with the help of the psychiatric medication, the psychology counseling, she's completely playing completely normally now. Third is a runner with restless leg syndrome. So this is a gentleman whom Dr. Mansi and us have treated together. And sorry, I would not say fully treated because it's work in progress. It's not fully gone. So he was basically a super type A personality. He was actually coming to Mumbai for getting treatment from outside Mumbai, and he had a massive business, etc. But at some point he was diagnosed with restless leg. He was on medication. He put on weight, which was all affecting his running now. And which is why he sought help from me, because he said, my running is getting affected and how do I fix this problem? So that's where again, the medications were going on, but I said, let's look at it again with now a sports psychiatrist, because we need to look at this not just with regular things. We need to dive more deeper into the aspects around this and go around that part. So we just spoke, Dr. Mansi, we just spoke that I think we have not fully cured this patient yet. It's still work in progress. But he had certain goals that for 2024 he wanted to do a particular race, for 25 he wanted to do a particular race. So he's at least done those. He at least managed to do those. That's where it was. This is a case of a housewife with shoulder pain. Okay, so this is about a 60-ish-year-old lady who came with shoulder pain brought to me by the husband. Shoulder neck pain. She visited close to 8 to 10 clinicians before, which included neurologists, physiotherapists, orthopedic doctors, that thing. And obviously not had much luck with the whole thing. Family itself also had doctors. And during my consult, like I said, I looked at the whole global picture. So more aches and pains came out, which was knee, ankle, back, everything in the last matter of 5 years. Everything came out. In this particular situation, MSK stands for musculoskeletal. Musculoskeletal assessment alone is not enough, because when somebody is having a full body of pain, we obviously have all heard of the term fibromyalgia, but she was not even fitting in that because she would have frank swellings in the body as well. So that's where I also looked at her entire metabolic health, and the metabolic health was also very poor. And with the last 1 year showing sudden increases in things. So that's where a deep dive conversations with the daughters, understanding what has happened in the house, conversations with the husband, all of that to understand, what is it that has changed for her in the last 1 year where things have happened. So all of this got together, and I actually told her, just let's work on your mental health and sleep and things like that, very poor sleep. And she said she basically remains awake for about 2 hours in the night, wakes up in the middle of the night, stays awake. So that kind of regular picture in a way. But because her personality was such that she wanted to work on everything, I said, forget you've already been to 10 physiotherapists before, let's not work on your shoulder pain. Let's work at something else. But she was convinced that no, I'm committed to my health and I will work on everything simultaneously. So with certain tweaks, we started off working on her physical health while I gave her small tidbits of mental health work. The family was not keen to get into full-blown psychiatry or psychology, unfortunately, at that moment. But the physiotherapists, I think we just have an SNC, but there's a physiotherapist also in the room. So, physiotherapists, we say that the way that talking and all happens, they have a lot of healing powers, because that whole conversation which happens with the patient and the reassurances, the small wins that, okay, yesterday you did this much, today you are able to do this much. That small wins which we keep showing the patients on a daily basis, that's very reassuring, because I think all of you all and whatever little I know of psychiatry, we know that deep down all of these things have certain insecurities and all of that. So giving the patients these small wins. Today she is much better than what she was when she came to us. Sleeping better, like I said, still not with the support of psychiatry, but unfortunately in India all patients are not going to seek that. So that's again the battle where we as maybe physical clinicians have to step in, where we throw in a little bit of mental health work without actually showing them. One other thing that we do, at least in our hospital, when people are exercising, we have the mental health coach or the sports psychologist just stand there and observe them. So they basically are consulting the person, but then they just go around later on and tell the physical therapist that, while this particular repetition was easy, when they gave them a new exercise, the way they reacted to the new exercise, so next time when you're teaching them a new exercise and you're telling them a new exercise that they cannot do, the psychologist gives an input that we observe the patient, why don't you go in and do this way. This largely happens for athletes who are what we call contracted with us, so because we cannot just go and comment on somebody else. So the Lance Foundation has certain contracted athletes. So we either do this for that particular group of people, where we just observe them from a distance. I mean, the psychologists observe them from a distance, and we go ahead and give that input to the physical therapist or the SNC that the next time try this particular input and see how this works. Coming to the last case, the toughest that I have ever seen. This was a case referred from the endocrinology department for guidance on exercise. He was a young boy who was visiting the endocrinologist because he had delayed puberty and he had to be put on injections to attain puberty. The reason for the delayed puberty was anorexia nervosa, so it's the relative energy deficiency syndrome in sport what we had. That there was he was just not eating and exercising excessively. He was obsessed with exercise, doing about 4 hours of exercise every day and not eating anything. So the puberty part was taken care of, but he was still continuing with this behavior of his. And that's when he was referred to us for exercise guidance. But then I referred him again to a psychiatrist. And again he battled a lot with it. He said, I'm not going to take the medicine. And unfortunately, between the parents and the psychiatrist, then they had to smuggle the medicines into his food in a liquid form or something like that. So he was still a young boy, so the parents took that up. And but the results that we saw, even on the exercise front, after the medication was started, were phenomenal. Till then, we had zero luck with him on exercise. We kept telling him, you do not require so much exercise, modify your exercise levels. But he was convinced that what he was doing was right. So we had to definitely take the help of the psychiatrist to work on his health. He was not willing to work with the psychologist. He was saying that nobody knows anything, I know my body the best. So this was a super difficult case. the parents had really kind of, I would not say given up, they were very supportive, but they were like, they were just very sad about the whole thing, the way everything had panned out. So, I feel this was one case where I had phenomenal results because of psychiatry intervention for sure. To see that how brilliantly he suddenly became receptive to our advice. Till then he was coming to us, but he was not listening to us. So it was, the parents had brought him, like I mentioned, that if the parents just bring somebody, it doesn't work. But all of that changed once this thing went in, and then he started doing, the exercises the way we had suggested to some extent, not a full-blown change, but to some extent. Nutrition-wise, we literally had to force him and bargain with him 1/4 protein more, 2 spoons more of rice. It was like a real bargain with him that please do this much more, otherwise your health's not going to improve. So this is again a case where we had a good intervention from psychiatry. So that's me. I wanted to mention something when ma'am spoke about the marathons. That the last leg is difficult. I was at the, that's very true, that the last leg, and a lot of times even the training for the marathon is completely mind-based. I was a doctor for the 555 kilometer run in Ladakh. So this is a 555 kilometer run which they have to finish in 5 days. So they have 111, 222 and 555. 111 gets over in 1 day, 222 in 2 days and 555 in 5 days. On the third day, the guy who was doing the 555 run, there were about 3 people who were doing it. As a sports medicine physician, I told the guy that your knees are badly swollen, your ankle is swollen. It was in July, but unfortunately it snowed heavily. It was a completely unexpected thing which happened. And he was in a terrible state. And I said, I think you should withdraw. He went and completed it, the first. Okay? And and I was seeing him, I'm like, how is he even doing this? Because physiologically, he was a complete pathological case as far as his knees and shoulders, knees and ankles were concerned. So that was my big thing that, medicine and physiology is like, he went and completed it, and he was jacked at the end of it, of course, everything was jacked. But he was also an army man from Australia. So I think, all of that psyche and all also helps. But so I told him on the third day, and after that he ran non-stop for 2 more days without sleep. So all of these guys, they take like 2-3 hours naps or something like that in the middle of the night. They sleep in the car, but then they again get up and do a little bit of running. So it's because they have to do 555 kilometers at the Ladakh altitude in 5 days. So like I said, it's absolutely not a joke. But that was my thing of, this is definitely a mind game for sure. And we knew that from all the Ironman and everything that happens, but this definitely convinced me that it's a massive mind game. So I just wanted to add that. I remember that. I don't put that in the slides, I wanted to add that. Cool, thank you. Any questions for me?
Thank you so much, Dr. Krisha. Excellent presentation. Definitely gave us more insight into what we could also expect. So I'm threatening all of you guys. I'm allowing 2 questions, and if you don't answer it, if you don't ask it, I'm going to pepper them with more. And then Mansi's going to be very upset because I'll ask a lot of questions and drag the time more. So I'm giving you only 2 questions. Right, Chouhan?
Absolutely. Please ask something. You shared such wonderful experiences.
Count of 3. 1.
So
yes.
So I wanted to know how often should the medical tests be conducted?
When you say medical tests,
so when you have an athlete with RF, right? There are some tests that you conduct on them. How often should they be conducted?
Case to case, but our general thing is annually we do a full panel, what we call. And we have certain nutrition parameters which we look at 3 monthly to 6 monthly depending on what the baseline value was. 6 monthly nutritional parameters and the full thing 12 months. But this is not again for a lot of the younger athletes. We mostly do for senior athletes because the exercise is a stress to the body. So the stress is higher with the elite senior athletes. The younger athletes, we really try and give them multiple sports. So all of that is encouraged. So that is the stress aspect is less. It's more about building skill skills a little bit and developing the foundation. So we don't do too much of blood tests with the younger athletes, but with the older athletes. And in the testing, one was the blood test. We also look at cardiac parameters, and so these are international sports medicine guidelines where they say that you have to be looking at cardiac as well, because sudden cardiac death is, like I said, occupies a couple of chapters in our sports medicine textbook, and it's rare, but when that happens, it brings a lot of things down. So screening for that is important. So we look at lung health, spirometry, cardiac health, and we do like DEXA scans, so like body composition assessments. You'll be surprised with the number of people who have osteoporosis. So because India is a big shooting nation, we have a lot of shooters, archers, and so it's crazy how much osteoporosis we have even in a 20-year-old athlete. Yeah, it's very surprising. Yeah. And we catch it early for these guys because, so we at least try to catch it early for them.
From Kerala, my question is age and sports. Because I'm a person who's been working out from 18 years. I'm 45 now, I still work out, but I've slowed down a lot. But I do find many of my doctor friends who started the marathon at the age of 40, 45, etc. Yeah, and they've never done any sport, but they're doing easily 42K, 41 and all, marathon. How safe it is, people playing badminton, etc., playing 8, 9 games continuously, etc. Is age of, is it a point of concern?
100%. 100% it is, and that's why we definitely recommend doing a pre-exercise evaluation. And that's what Dr. Mansi was asking about, these tests. So we do that pre-exercise evaluation even in young athletes, like athletes who have already been playing for years. I mean, there was a case 4 years back of an athlete at a very, very high level who collapsed in a cardiac event and who had to be revived on the field. That athlete had been playing, athlete was playing in the Euro Cup. When an athlete is playing at the Euro Cup, he has played for many years before that, but this still happened. So this can happen at any age, and now with everything increasing, we definitely recommend both cardiac screening as well as musculoskeletal. Both of them is recommended. What we also do with our Relax Foundation athletes is we do, with them in fact we do more, we also do psychology. Sorry, that was one more thing I wanted to add when ma'am mentioned about the thing. We do a pre-assessment, we call it runner's risk evaluation. So we do that, we have a steady package in our hospitals. So as part of that runner's risk evaluation, we look at cardiac parameters, blood parameters, we look at the general fitness, and we have about 5 questions on psychology. The questions are, so that's just a screening. So if a person answers that in positive, then we would say, okay, consider. So there are things like, do you compare yourself with your other runners? Do you get stressed if you're not meeting your targets? And some questions around those lines. So if they answer, and the options are sometimes, always, those three or 5 these things. So we do a full screening because, like I said, like it was in that restless like gentleman, he was just too super anxious with his performance. So somebody like that, if we had caught him earlier, suppose, you start working with him, then maybe he doesn't reach the level of anxiousness. With the cardiac stuff, I have unfortunately picked up people and who have been, I don't know if you know about the Comrades race. So these are big races. They are due for Comrades in 2 months' time, and I have unfortunately had to send them for bypass surgeries. So when I say in the sense we pick up something in our screening, then we refer them to the cardiologist, and then that's a decision between them and the cardiologist, and then we come in to advise that is this safe, is this risky. So there are multiple things we can look at, family history, all the various parameters. There have been a couple of things like that. There was one gentleman who was scheduled for a runner's risk evaluation with me on a particular day. 3 days before that, he went for he was a regular badminton player. He was playing badminton, he had pain, and he went in for an angioplasty. And he was actually scheduled with me for a runner's risk evaluation. And his wife called that, hey, we are in HM, but we are already admitted for XYZ, so we are going to cancel your appointment. I was like, okay, I mean, I don't know what to say, but anyway, glad to know that he is safe. So this has now become extremely common, but it's not a reason to not exercise. Okay, that's I've had few very elite people come up and say that somebody, my family member, died on a treadmill, so I am never going to get on a treadmill, and that's why I don't do any exercise. That's not the way. You know, we have to figure out a safe way to do it. And that's where, as part of the testing, you know, doing a basic stress test and we add on certain things, we figure out what is your safe zone to exercise.
Yes, I think cardiac angiography is also advised very nice.
Yeah, so we have, like I said, so we do a history and then we figure out the various tests. So we have various, you know, the way we have designed it.
Marathon, all people, they are doing one by one. They
Sorry?
are above 40. They are doing one by one all.
So I'll tell you, with the cardiac angiography and even in fact for the stress test, you know, like we have people who got a positive stress test and who got a negative angiography. Okay, so that's also, that all happens. So all of this has to be taken in a holistic picture. What is the demands of the person? What are the complaints of the person? It has to be taken in a combined picture because we've got positive stress test with zero calcium scores and zero angiography. So it's a mixed thing. It has to be taken as a combined clinical decision.
Thank you. I don't think this is working, but thank you. Then I have technical issues with me are common. I know a couple of questions are still waiting to be answered by her, but I'm hoping that you guys can catch her during lunch and not let her eat and make her answer more things. I'm going to really take the privilege of being a chair and ask you, I'm a psychiatrist, my job is to diagnose and prescribe. As a sports physician, what am I supposed to be wary of or look out for before prescribing? Sure, we know that okay, most medications are allowed, most of them are safe, some are preferred over others. But having said that, overall, what cautions do we apply? How do we even approach patients, especially if they're competitive athletes? They are morbidly scared of even a diagnosis because they look at it as that, oh, this is going to negatively impact my game, my killer instinct and things like that. How do we navigate all of those?
That's a lovely question, ma'am. So first, the most important part was on which medications are safe. So safety, two things. There are certain medications which are banned in athletes. Athletes are not allowed to take them because they are performance enhancing, and if an athlete takes it, he would get an unfair advantage above the other. However, if medically indicated, we apply for something called as the therapeutic use exemption, which has to be applied for before the medicine is taken, and it's reviewed by our therapeutic use exemption committee, and they say that okay, this person actually requires this medication just to become normal. It will not enhance his performance, it will just become normal. This is a massive list. I don't think a lot of psychiatrists, no, actually they do, some medicines do, so it's very easy. There is a particular website and we can just go and put the name into that website and it says if it's prohibited, it's not prohibited. Sorry?
Most stimulants are not.
Yes. So, but funny enough, so ADHD is the commonest this thing of, so that's for the therapeutic use exemption. Yeah, it's unfortunate. That was about the safety from the ethical sports point of view. The other safety is just the general safety, which would be there from any adverse drug reaction point of view. With the athlete, maybe timing of the medication, seeking it, when to start it, peri-competition, so understanding the athlete's competition cycle is very important. As to, they naturally be, they have certain free times. So I always advise that anything is started in the free period. They get used to the medicine, excessive sleepiness, which may happen with, so athletes typically have morning schedules. So all of those have to be taken care of. And the other thing you asked was, I think I just put out.
The fear of diagnosis.
I think you all are the best to handle that. Fear of diagnosis. I think that will be person-to-person basis. There are some athletes who are very happy to take it, but largely in my experience, it's very variable. We may feel that athletes are strong, but we've seen that yeah, they are scared of the diagnosis, even if it's an injury diagnosis. So mental health will obviously hit them slightly more. But yeah, they are scared of injury diagnosis, the denial and all of that. Same stuff happens in vets, athletes as well, very much. They are humans first.
We wrap it up. Thank you, Dr. Trisha, for giving us a glimpse into the work that you do with very challenging examples. Thank you so much.
Ma'am, just a second. With that, I would request the chairpersons to kindly felicitate Dr. Trisha. And now I would like to request Dr. Sujoy sir to kindly felicitate Rukshita ma'am and Shobha ma'am.
स्पोर्ट्स वाले चेयर वाला ही शील्ड मिल गया नहीं बहुत कुछ लिखा हुआ है Trisha, you want to come and join us for the picture? Trisha, Amar and Saman, see the picture as well.
Thank you so much, everyone.
सदियों पुराने लिखे गए महाभारत जैसे महाकाव्य में माइंड बॉडी इंटरसेक्शंस के बारे में काफी अच्छे तरीके से वर्णित किया गया। मिसाल के तौर पे दो उदाहरण आपके सामने रखना चाहूँगा। द्रौपदी स्वयंवर में जब अर्जुन के लिए एक टास्क था कि मछली की आंख को खोलना, जो भी कॉम्पिटिटर उस आंख को खोलेगा वो द्रौपदी को बरवाला। इस उदाहरण से ये साबित होता है कि इसमें फोकस, कंसंट्रेशन, माइंडफुलनेस इन सब की कितनी बड़ी अहमियत है। दूसरा उदाहरण हमारे सामने आता है वो है भगवद गीता के, जिसमें अपने कर्तव्य को सबके ऊपर रखने के लिए भगवान श्री कृष्ण अर्जुन को बताते हैं, जिसमें सेल्फ बिलीव, reduce your inside fear and keep your purpose on higher side for motivation. ऐसे उदाहरण सदियों पुराने लिखे गए इंडियन माइथोलॉजी में हमें काफी बार देखने को, पढ़ने को मिलते हैं, जो वाकई हमारे लिए एक अलग इंस्पिरेशन साबित है। So that's the beauty of today. True integration of fields, sports medicine and sports psychiatry working together. And for that, I would like to thank another one of our sponsors, Dronacharya Awardee, for making it happen. Thank you.
I think we will take a 5-minute break for a tea. Tea is there.
I suggest let's not take a break. I'm happy to go on with the lecture. All of you are free to just pick up your teas and coffees because otherwise you'll be needed for share.
Okay, so as announced, we'll start with the next session for the day. And for this, I would like to request Dr. Rohit sir and Dr. Kartika sir to kindly chair this session. living in Mumbai and they don't need any introduction. So,
Yes, let's do that. Excuse me. Yeah. Can I take a picture? Okay.
आप इधर से नहीं बोलो, no pushes perfect. I think this
we have Dr. Rohit also, who is the co-chairperson, and I would like him also.
I would like to thank Indian Psychiatric Society to concentrate on this topic, basically, the sports psychiatry. Generally, sports is taken to be in a different mind space. We see it like that sport persons are always fit, but it's not like that. They do have struggle, they do have psychiatric issues, mind issues, and this kind of things will help them make the awareness more about the sports psychiatry and whatever they are going through daily in their life. So I would like to thank IPS, and also I would like to thank Amar sir and Nancy ma'am who organized this program. Thank you.
All right, thank you so much, Dr. Rohit and Dr. Rao. So yes, I completely agree. When we started out, even our own committee members had the idea that sports psychiatry meant sports for psychiatrists, and I think a lot of work has been just around trying to educate people. It does not mean sports for psychiatrists, but it's psychiatrists for sports persons. So with this, the whole idea of today's conference was to educate people and bring, especially psychiatrists, the sports psychologists who are working in this field know the teams that are involved, but sports psychiatrists or psychiatrists are not really aware of different teams that work on an athlete and how we bring across all the changes and improvement in their health. So the idea was that, I think, till now we've been able to accomplish a little bit of that. We had an aquatherapist, we had a strength and conditioning coach. A couple of years back, I would have known none of these concepts or stuff myself. So glad that we're able to bring about that. Now, while everyone has spoken about the importance of mind, and we all know, like everyone, Dr. Twisha and the ones who are already into marathons and running and all sorts of sports, they are also agreeing to this. But we end up looking at the mind as something that's a very, very abstract concept, right? We think mind means something like an abstract drawing, just koi parameters nahi hai, just koi measurable cheezein nahi hai. And today with this talk, I intend to change that thought and bring about more awareness on the fact about how brain is actually our mind. So when we talk of mental health, it's actually the brain health. So what is the scope for a sports psychiatrist? Of course, evidence-based assessment and treatment of mental disorders in athletes, understanding the neurobiological effects of training. So like all the speakers before us said, it's not just that you train and it's something you just get used to. It definitely has an impact on your body. And the idea that people have is, when we speak of a sports psychiatrist, they believe it's just a general psychiatrist in the context of athletes who's applying the same principles to athletes. That's not how it is, unfortunately. There's a lot of education that needs to be done around that. We have to understand the impact of training on a person's body, their brain, the adaptive, the maladaptive changes that we see. And of course, Dr. Twisha already mentioned the first half of this patient that we were co-treating. I will be discussing the other half, and we know how and why it is important. The third part is the interface with physiology, sleep science, injury medicine, and nutrition. So, what have we learned today? Since morning, all these different lectures, what do they comprise? It's actually sports science, right? So, sports science means you understand the various aspects, the scientific aspects of science. And what I did notice was, when we were given information about the technical ways of dealing with this, we were very curious about it. Anything that's measurable, anything that's quantifiable, anything that can be objectively seen, understood, is definitely of importance and value. That's where research is heading in psychiatry as well. And the most important, a lot of questions were asked about this, the ethical and medical legal considerations, more so when it comes to psychiatric medicines. Okay, so what is the epidemiology? Of course, we all know, like most of us psychiatrists here and with some psychologists, when someone has mild depression, mild anxiety, we always suggest exercise to them. So this tells us that we are looking at exercise as a therapeutic medium, right? But exercise, when it is done just as a recreation, it is therapeutic. When you keep on exercising a lot more, it's not only therapeutic, but it can actually be a reason why you may be unwell, both physically and mentally, psychologically. Of course, so the prevalence is not lower. When someone does have some psychological comorbidities, they end up taking sports as a coping mechanism, but they also face some mental issues because of their pre-existing conditions or their pre-morbid personality. And sports, by virtue of, when we say sports may lead to mental health issues, we only understand one thing, and that is the performance pressure. That's not really true. It's not just the pressure, it's the effect, the neurocytokine changes. That is very important. So we have to understand that. The rates are, in fact, maybe as much in the general population and the sports persons, or sometimes even higher. But it is underreported because of the stigma. Of course, the higher rates of anxiety, depression, sleep disturbance, and all of these are related to the competition. Going on to the next slide. So we have to understand that when someone is training, there are changes in their brain because of the constant mechanical strain on the body and constant use of motor system and motor activities. Their corticostriatal and corticocerebellar pathways become much stronger. Training load definitely brings a change in the HPA axis, in the way the amygdala responds and reacts to situations. The functional connectivity changes. Like I explained, the stress regulation is very, very different in athletes as compared to the normal population. So every time there's a talk on sports psychiatry, we always talk about how we need to understand that a pre-performance anxiety is an absolute normal circumstance in sports, but it may look like anxiety disorder to someone who does not understand the context. Yes, Devika was asked by Dr. Amarshande of how, when the training is so boring, how do they even manage to sustain for so long? And I'm not an endurance athlete myself, but what I do know is sports persons have their brain wired to achievements. The cognitive, the psychological, and the motor, as we know, we understand, they are not compartmentalized like a 3 BHK or a 4 BHK that we have. There are no walls in between. They are all very much overlapping and very much interdependent on each other. So mood and performance are going to be affected by sleep architecture, by sleep disturbance. I'm sure a couple of us here use the gym, go for swimming, do some recreational sports. And what happens? I know Rukshita ma'am puts up posts about leg days sometimes. And what happens when you have a leg day at the gym? What happens? You're ready?
I always exercise, but I never do it very enthusiastically, but I'm very committed to it. Having said that, leg days are, oh my god, they are the most terrible things for the simple reason that day might not be so bad, but I pay for it the next day and the day after that, and that, even the memory of it, oh, I'm going to go through this, is also that the distress increases because of it. Also, it makes for a funny meal.
Yeah, absolutely. And so when you have a bad leg day, what does the gym person tell you? What does your trainer tell you? Soja, have proteins and have enough sleep.
Like that was irrespective of the leg day. Maximum of being nice to me and kind to me, they'll be like, oh, you know what, sleep well, regular water, but also why don't you go for a nice massage, and that will help. If you're in a nice mood and want to be nice to me, I've done all my reps. That's it.
Good. Glad to know that you're regularly exercising. Thank you.
Yes. Sustainable lifestyle.
Good, fantastic. We all should learn, right? So the point of this is that sleep is the most foolproof way and an absolute prerequisite for recovery whenever we are having any strenuous muscular exercise. And as people who are not into sports, we may be okay with a couple of hours here and there, but ask any athlete, if your sleep gets disturbed, their performance, their reflexes, their recovery, everything will get affected. So this is for us to understand that all these physiological parameters have an impact on the way we perform or an athlete performs and their mental state as well. Low B12, low iron or changes in the iron, the ferritin, vitamin D deficiency, all of these can lead to fatigue, cognitive slowing, irritability, and literally these symptoms are what psychiatry is made up of, right? So it's very easy for a lot of medical changes or disturbances in the body to mimic psychiatric conditions. So it is very important as a sports psychiatrist to understand that not every symptom that looks like a psychiatric symptom will purely be psychiatric. The understanding of the medical aspect, the physical aspect is important and has to be assessed. Yeah. Glucose availability. Ms. Apurva, the nutritionist, she did mention about how low glucose availability, and we all know, like little drop, we can't make good decisions. Imagine someone performing and having to use their reflexes and cognitive abilities to the full capacity. It definitely has an impact. So what are the clinical phenotypes that we usually see? Well, the whole DSM, the whole ICD will have a representation in the athlete population. But what do we commonly see? Performance anxiety versus generalized anxiety, overtraining syndrome mimicking depressive disorders, injury-related adjustment disorders, somatic presentations influenced by autonomic dysregulation, and post-concussive mode and cognitive syndromes. So, performance anxiety and generalized anxiety look very much similar. It's just the timeline that matters. When you have an event and that's the only time anxiety shows up, then you call it performance anxiety. Most often, psychological measures will help, but a lot of times, you may have to go for medication. So Ms. Amrita here, she ended up referring a patient to me recently, a young chess player, of course not going to name him, but even while in the OPD, when he was talking to me, he was so jittery, he would easily qualify in anyone's, like you don't even have to be a psychiatrist for you to know that he's very anxious. And this was without any competition, without, even after half an hour of talking and comforting him. Now this person definitely volunteered medication, but a lot of times with a lot of psychological measures that can be taken care of. We look at overtraining syndrome and a few other conditions in a little more detail, but injury-related adjustment disorders. So it is well known that for any sports person, injury, deselection, and retirement are three most stressful periods of their life. With injury comes fear of re-injury, comes fear of not being able to go back, means return of sport, and the fear of deselection. So they are huge transitions in their life, and these are the periods when they are more vulnerable. Overtraining syndrome. So what is it basically? It's an autonomic imbalance, and it happens because you're training your body a lot and not allowing it to recover enough. What this does is it leads to release of inflammatory cytokines, and because of that, your body starts feeling fatigued. You're training more and more, but performing less and less because your body has not recovered. What is the medical parameter to assess here? You will have a reduced testosterone to cortisol ratio. There are a lot of other things, but this is one of the most diagnostic. And the history is very important. As we go ahead, and as Devika had also mentioned a few things that we psychiatrists always ask for, I will be covering them as well. Now, why are we concerned with it? Because a lot of times it will not go, these patients, they will not be going to a medicine physician or any other expert. They will most likely come to us because of low mood, because of irritability, because of lack of sleep. And it is on us to be aware, to ask the history about the amount of training and the time they are getting to recover, so that we do not misdiagnose this and only treat them as a psychiatric condition. Now, Dr. Trisha spoke about it, the relative energy deficiency in sports. I recently have a friend, and we are doing the Sports Psychiatry Clinics of India, again under the IPS banner. It's caught up a lot of momentum. I think more so because 2030 Commonwealth Games are happening in India, 2036 IOC may happen in India, so everyone's now quite keen about understanding sports psychiatry. And she was like, do you know what REDS is? I said, yeah. Like, did you know this before you did sports psychiatry? I said, no, I didn't. And she has had athletes, because by law has a lot of these academies, she has had athletes who come to her, and one of these persons, the mom was like, it's not REDS, we know that. And my friend was absolutely lost because she did not know how to take this conversation ahead. So I thought I should definitely put this. Relative energy efficiency in sports. So what happens is, a lot of times, especially the weight categories, or because there's this myth that if you are lean, you will be doing better in sports and all of that. People eat lesser than the caloric requirement of their body, and when this happens, there's a change, a cascade of reaction happens in the body, your immune system, your hormonal system, all of this starts going off balance. So how do you know this? There are changes in the sex steroids, there's also suppression of the thyroid hormones. The psychological consequences, low mood, irritability, impaired concentration. This again mimics any psychiatric condition. And so awareness of this. And what can we do as a psychiatrist? How often do we send someone for hormonal testings or sex steroid testing? Not very usually. The least we can do, or at least for us to know whom to send, the least we can do is take a good history. When we take a good history and discipline tells us that we can't be just talking of the mental aspects, we have to know their physical training, we have to know their nutritional status. This reminds us of the multidisciplinary care that sports persons need. Alright, so sleep and neurocognitive performance, I'm not going to spend a lot of time on this, but as we saw, even 1 hour deficit in sleep can lead to significant impairment in performance. So sleep is both diagnostic and therapeutic. As psychiatrists, we know there are a lot of conditions where we would look at sleep and we would be able to understand if there are symptoms. Injury, pain, and mental health. So injury, again, is pain of injury, yes. And the fear, the psychological fear of deselection, fear of injury, return of sport, yes, they are true. But injury by itself will lead to release of neurocytokines, a lot of inflammation cytokines, and all of this, not just the psychological aspect, but the medical aspect of injury. These biochemical processes also make people more prone to psychiatric symptoms. Immobilization. So imagine someone who's training for 6 hours, 8 hours, 10 hours. The cortical representation of the physical body is far higher. And imagine not doing that for 2 months, 3 months, 6 months. So the cortical representation in the brain, going back to anatomy first year, that also starts getting changed. Of course, there's a very high vulnerability to depression, fear, and avoidance behavior. So like Ruchira just mentioned that go ahead and just remembering what you said. When you're having a bad leg day, the next time you're going to have a leg day, you have so much anticipation about it. Same is with a sports person, but amplified multiple times. Going through an injury, it creates a fear of re-injury. So even though they want to return to sport, it cannot happen until they have the psychological fitness about it, until they are psychologically prepared for it. Of course, the psychosocial contributors that we spoke of was loss of the role and pressure to return. Performance anxiety, again, what happens in the brain? The amygdala starts having changes because of being in constant high performance state. And there's, of course, a cortical interference, so motor execution will break down because your body is extremely sensitive to all the sensations happening in the body. This can again show up as choking. A lot of athletes, because of their tendency to be in high pressure zones, and because of the mental and social training, conditioning that athletes are supposed to be mentally tough, a lot of athletes will not show up with cognitive aspects of anxiety. Means they will not show worrisome thoughts, but will show a lot of somatic symptoms. What are the effective interventions? Graded exposure, acceptance and commitment theory, biofeedback, and heart rate variability training.
What do we assess? As a sports psychiatrist, apart from the regular assessment that I would do in any psychiatric patient, what else am I supposed to carry out? Detailed medical, psychiatric and performance context. The timing of a competition, how much do they train, how much time do they get for recovery, what is their nutritional status, very important. Detailed training load history. The red S screening, there are these tools, the screening tools called leaf queue and energy availability. These can help us at least screen for these conditions. Sleep profiling, we have a sleep expert coming in today. So sleep, and she's going to cover CPT for insomnia, which, so I did not believe in CBTI so much before. Being psychiatrists, we are quite prone and inclined towards pharmacotherapy, and sleep happens to be one of the most challenging areas to completely treat. So in my head, I had this notion, दवाइयों से नहीं हो रहा है, counseling से कैसे होगा? And last month I was in Scotland for a conference, and the amount of emphasis they give to CBTI, I think it's well worth for all of us to understand and even try and use it in our practice. Substance use, supplement review, injury timeline, psychosocial ecosystem. Like everyone else said, it will most likely be the physios, the coaches, the other people who will actually be referring the patient. They will notice a change in the patient before anyone else, even before the family sometimes. Dr. Trisha had another commitment, so she had to leave. But we had a long conversation about how a lot of Indian athletes, they end up performing poorly in spite of having a wonderful skill set the moment there is parental pressure. So there was this athlete, he's extremely gifted, but the moment the parents tell him, "Itna time ho gaya hai, kuch zyada ho nahi pa raha hai, stop doing this, let's just get you back and start earning money," the performance absolutely spirals down. So this tells us the importance of the psychosocial ecosystem. Again, I'm going to skip this part, but there are sports-related specifiers. Okay, Dr. Sujay wanted to click a picture. I'll allow you to do that. Or I'll send you my PPT. Okay? Okay, so there are sport-specific specifiers. Why are they important? Because what may look like anxiety, what may look like depression, what may look like a lot of other things could only be a temporary sports and event-related episode for them and may not need strong pharmacotherapeutic interventions. Very important to consider atypical symptoms. They do not show up with the typical symptoms of anxiety, not the typical symptoms of depression, not even the typical symptoms of OCD. So very, very important to be vigilant and constantly be actively looking for them. Okay, very important for pharmacotherapy, we need to have WADA compliance. So there was a question on what should we be careful about. Stimulants, very necessary to be careful, but again, the most commonly abused in the therapeutic use exemption category, beta blockers. What do we use? As a psychiatrist, if someone comes and tells you, "Ma'am, I have this event and I'm feeling very anxious, what should I take?" Beta blockers. One of the safest that we feel are to be given to anyone who comes with performance anxiety. Absolutely contraindicated in a lot of sports, especially shooting and archery, because they have an anti-tremor action, right? So the anti-tremor gives you an enhanced benefit against your opponents. So beta blockers we may rampantly use, but they actually put an athlete in trouble. Glucocorticoids, cannabinoids, it's very important to also know the timeline. So again, go through the WADA guidelines. There are these websites called the DRO Global where you can check these medicines, and there are some pills that are completely banned throughout. There are some that are banned during a season, before a season, after a season, depending on the timings. So for you to be aware. So if you ever interact with, let's say, Mr. Sethi hai jinhone SNC karaya, if you talk with Vish, or if we ever have a discussion about an athlete, if I would talk about them, I would be aware of their competitions. I would know he's going for the Chicago Marathon now. It's like knowing कि इसका exam time पे pre-morbid anxiety कैसे होगा. You know how we make a mental profile of a patient? Most of us will always remember what competition, when, how, because that's how we actually decide what meds to put them on. Okay, so timing related to training and competition. Again, no, I've already spent a lot of time, so me saying I'm not going to spend any more time makes no sense, but quickly. You're here because I've crossed my time?
Oh goodness, I told them you have to be really strict with everyone. There's no point being nice. And here I am asking for concessions. Okay, I'm just going to discuss maybe one case or two quickly. Again, this was an elite endurance athlete competing at an international level. Came to me through a psychologist because of low mood and irritability, but when we got the medical profile done, it showed iron deficiency and high training load. So we had to take care of that, and we did not even have to put this athlete on any psychiatric medication, and the athlete got better. Performance anxiety, I've already mentioned it, so I won't cover that. Again, I'll skip the post-concussion syndrome. Now, this was 14-year-old swimming person, a swimmer, and she was doing quite well, really good at it, won a lot of competitions. What started happening to her was there was a lot of, a 14-year-old means there's pressure to perform at school, really good in school as well, so pressure to perform at school, pressure from the family that you're investing so much time, you're taking away time. So there's an opportunity cost in sports, right? You give away the most precious years of your life in an attempt to build a career in sports, and if you don't build a career, you don't have much left. So because of this opportunity cost, a lot of family members generally put a lot of pressure. So what was happening to her? Sleep disturbance, irritability, perfectionism. What we did here was actually train the parents, counsel the parents, and like Dr. Visha said, very few children are blessed with parents who are okay with their child not being, a superstar. So in her case, we did that. We also taught her some grounding techniques, and she did well with that. With this, I just quickly go through the medical legal considerations. Confidentiality, very challenging. On paper, it looks like just another word that we use in psychiatry, but no. Confidentiality is a big deal because the athlete trusts you to not tell any information to anyone, but you know that sometimes you might have to reveal it to the coach, to the federation. So balancing that dilemma and knowing the regulations around that is extremely important. Anti-doping rules, extremely important for us to know, or anyone. Documentation. POXO, we have a session, but I recently had, and the reason we have a POXO session today is recently I had a mail about a patient who is 16 now or 15, and the mail mentioned sexual assault. The email, the formal documentation had the word sexual assault, and that could mean so many things. So the idea and understanding of POXO for all athletes, for all doctors, and what should you do if you come across something like this, and coaches is extremely important. When we talk of POXO for athletes, a lot of times the parents will not want it at all because they feel their career is at stake. So what should you and me do if I know that someone has, there has been an event which would fall under the category of POXO, the athlete is unwilling, the parent is unwilling, what are we supposed to do? So please, I won't be answering that, we have an expert coming in for that. And lastly, it should be a multidisciplinary team effort. With this, thank you everyone for your time. Everyone's patiently listening, so I think that has been the greatest learning. Can I take 1 minute, not as the speaker, but as the organizer? We had registrations from Hooghly, self-funded, self-registered, from Orissa, from various other parts of the country, all of it done all by themselves. We all know how conferences work in psychiatry. For us, that was the biggest achievement, that so many people were keen, and we already have somebody here from Cochin who is self-registered, self-funded. So this tells us that it's a niche, but it's catching momentum. And what we have today is a genuine set of audience who's genuinely interested. Of course, the Indigo flight fiasco has affected our event largely, but we are extremely happy that we have a very genuine audience. Thank you everyone.
Thank you so much, ma'am, for that talk. I would like to request our chairpersons to kindly felicitate our speaker.
you.
Now I would like to request Dr. Shri sir to kindly felicitate our chairpersons.
So wonderful talk, huh? It's, I think, very nice to hear Mansi speak about so many technical details which we are not aware about. I think you should take a workshop on us for something like that. You said that
It's happening at concepts. So
great.
even without wanting it, I'm promoting concepts.
So,
Look at the camera, sir. Thank you.
Thank you so much, doctors, for that.
So brilliance music, same here. Those kids next were likely watching a master class.
Athletes train muscles every day, but training the mind, that's the real secret.
And Dr. Mansi ma'am had just proved why sports psychiatry is the future.
And with that, we're going to take a quick half an hour break for lunch. And we expect all of you to come back within half an hour. Thank you.
Recharge, network and we will be meeting in an hour. कहने का मतलब है कि पापी पेट का सवाल है, दावत फरमाइए। चुस्की मुर्दे के साथ फिर एक बार मिलेंगे कुछ ही वक्त के बाद। Thank you.
Dr. Faizan, please take the seat. Thank you.
Yes, one question.
Yes, Dr. Faizan, you want Alright. Okay. So, in the history of psychiatry, we have a very amazing, huge thing planned today.
What kind of it is?
We are launching a newsletter. In the history of psychiatry in this country, we have never done it. It's going to be a newsletter covering just information about sports psychiatry. And it's a huge deal, even bigger because we have the editor of the newsletter here with us. And I'm going to give her a moment to correct this. Thank you, Dr. Neha, for such a grand launch of the newsletter. The idea behind the newsletter was, I was in Scotland 2 months back for a conference in sports psychiatry, and what I realized was that there's need for more awareness and exposure about the whole field with the 2030 Olympics happening and with a lot of other sports-related activities happening in India. There is definitely this, I'm not even talking in terms of business, but I'm just, in terms of an industry, it's increasing, there's a need, there's definitely a need, and the supply is less, the awareness is far lower. So the idea of the newsletter is to be able to put across, because we can't always get people from across the globe, and people who are working in different ways in the field. So the idea was to bring across some articles and experiences of people, not just from India but even from outside, and to have our Indian population have an exposure to that kind of knowledge and expertise. With that idea in mind, we have for the first time under the IPS banner launched a newsletter. So a huge thanks to the whole office bearer team at IPS, Savita ma'am, Dr. Amrit, because they are so proactive about all these things and they allow us to take ahead any activity that is going to benefit the society. With that, we have the IPS Direct Council member, Dr. Amar Shinde, who is also the person behind this conference. So, Dr. Amar Shinde sir, may I please have you here? And Dr. Sare sir, I might have to. So sorry, but I have to ask you to leave your dessert behind for a minute.
Always sports conference मध्ये सोडावं लागतं dessert.
Dr. Chouhan, madam. So Dr. Chouhan, madam is the current BPS secretary. So we have all the elites here. And with this, we would like to just have a launch of the newsletter. And after that, I quickly run you through.
You did, you said it. I am both president plus secretary currently. going on holding 2 posts.
Did I announce secretary? Oh God, I'm so sorry. My bad.
No, but that's the truth.
Exactly. I didn't intend for it to be the truth.
That's the reality. Alkesh knows it best.
Yeah, so she is the current president on paper and off paper according to her also the secretary. So, Dr. Sujay, may we also have you, Dr. Sujay, Dr. Alkesh.
Sujay, Alkesh, and Karthik.
Yes. Oh God, my excitement is too much.
So we all should release it simultaneously. And 1, 2, 3. Let's do it. 1. Wait. This side. Sorry. No problem.
Sir. Go ahead, sir. Show me the front. Yes. Yeah. Sir, hold on. Wait up. When I am saying action, then ready, sir? Action.
photo clip. Look at the camera, sir. Good, sir. Look at the camera, sir.
Thank you.
Wonderful.
And if I may take a moment to just quickly describe what we have in this. So, we have, you want to say something? So we have a letter from the safeguarding officer, the senior at the International Olympic Committee. We have an article from the ex-secretary of MCA, the Mumbai Cricket Association Club, that is Mr. Abhay Hada. He just got done with his post recently. And there's one article from me. Dr. Sagar Karya is not here, but he's the quiz expert of psychiatrists, so he sent across a quiz for us. We have a quote from Dr. Amar Shinde, we have a quote from Dr. Amrit Patto Joshi, who's also quite keen in sports psychiatry. And we have another article from Miss Sanjana Kiran, who happens to be in the industry. She's a global senior consultant when it comes to high performance. She is catered to a lot of clients, a lot of current Indian cricket team members. So we have articles from all these people who come from different areas. And when we want to improve the quality of awareness and education when it comes to sports psychiatry, we will have to involve all the stakeholders. And this newsletter is doing exactly that right now. So with this, what we are going to do is, whoever is interested, we will pass on the digital copy of this newsletter to them. And I'm hoping that we can continue this journey in the future as well. Thank you.
हिंदी फिल्म इंडस्ट्री के एक पुराने गायक जिनका नाम महेंद्र कपूर था, बहुत सालों पहले देशभक्ति के लिए उन्होंने एक गीत गाया जिसके शुरुआती लफ्ज कुछ इस तरह से थे, ये देश के वीर जवानों का अलबेरों का मस्तान। इसी लफ्ज को दोहराते हुए मैं यहाँ पर कहना चाहूँगा कि उनमें से ही एक अलबेरा या फिर अलबेरी यहाँ पर है जो वाकई काबिल तारीफ है, काफ़ी उम्दा शख्सियत है उनकी। उनसे हमें आज रूबरू होने का मौका मिलना हम सब के लिए एक फ़ख्र की बात है और साथ में एक उम्मीद की। उनकी पूरी ज़िंदगी संघर्ष से गुजरी है। साथ ही में यह संघर्ष हम सभी लोगों को एक अलग तरह की उम्मीद देता है कि हमें कभी भी संघर्ष का मैदान छोड़ के भागने की ज़रूरत नहीं, बस डटे रहना और उसका सामना करना हमारे लिए काफ़ी ज़रूरी है। तो स्वागत है आप सभी का इस मंच पे और इस कार्यक्रम में फिर से एक बार प्यार से। यहाँ का हर लफ्ज़, यहाँ के हर लफ्ज़ में होगा जादू और बातें होंगी खास अंदाज से। यहाँ मैं इंट्रोड्यूसिंग मिस the captain of India's Paralympic basketball team.
We welcome you, Geeta Chouhan ma'am. have a conversation with ma'am so that we can learn better about her life.
तो शुरू करने से पहले मैं कुछ 2 लाइन लिखी। कहते हैं हौसलों की उड़ान में परों का क्या काम, जहाँ सपनों की आग वो वहाँ सीमा का क्या काम। शरीर अगर रुक भी जाए तो क्या हुआ, इरादे चलते रहे तो मंजिलें खुद रास्ते देती है। आज हमारे सामने जो है वो सिर्फ व्हीलचेयर बास्केटबॉल खिलाड़ी नहीं, वो न्यूरोप्लास्टिसिटी की गलती फिरती मिसाल है। जहाँ शरीर ने कहा नहीं, वहाँ दिमाग ने कहा क्यों नहीं। तो कृपया तालियों के साथ स्वागत कीजिए कैप्टन। बचपन में जब पोलियो हुआ, जिस उम्र में बच्चों की दुनिया कार्टून और चॉकलेट होती है, उस उम्र में आपने स्ट्रगल, स्टिग्मा, सर्वाइवल सीखा। आपकी भावनिकता में भी लड़ाई कैसी थी?
पहले तो धन्यवाद आप लोगों ने मुझे यहाँ बुलाया और मुझे सुनना चाहते हैं सब लोग, तो मैं भी बहुत खुशी से आप लोगों के साथ शेयर करना चाहूँगी। बचपन की लाइफ आपको भी पता नहीं होगी, मुझे भी नहीं, और क्या स्ट्रगल है क्या है। जैसे सब बच्चे चॉकलेट्स, टीवी और आम बच्चों के साथ खेला, मेरी लाइफ वैसे नहीं आई। बहुत सारी छोटी छोटी चीज़ों के लिए हम तरसते थे। पहले तो मेरे स्ट्रगल में शुरू हो गया कि स्कूल्स में एडमिशन नहीं मिल रहा था जब डिसेबिलिटी मेरी पोलियो। लेकिन ऐसा रहा कि मेरी दीदी ने मेरे साथ दिया। माँ की जगह मेरी लाइफ में दूसरी माँ भी है, कहीं ना कहीं मेरी दीदी, उसकी वजह से मेरा एजुकेशन हुआ है। और स्कूल में एडमिशन प्राइवेट स्कूल ने तो मुझे डिनाई कर दिया था, बट जब गवर्नमेंट स्कूल ने मुझे एडमिशन दिया तो वहाँ पे स्कूल में रहना, पूरा दिन मुझे वॉशरूम लेके जाना, मेरी दीदी ने सब किया। और स्कूल की लाइफ में बहुत डिसअपॉइंटेड रहती थी मैं, मतलब चुपचाप रहना, मस्ती नहीं करना, एक कोने में टेबल पे बैठे रहना। आम बच्चों के साथ डिफरेंसेस होते थे क्योंकि उनके बच्चे दूसरे बच्चे हमारे साथ मेरे साथ खेल नहीं सकते थे और उनके पेरेंट्स को लगता था शायद मेरे साथ रहने पे उनको भी हो सकता है डिसेबिलिटी। बहुत सारी चीज़ें हैं छोटी छोटी, मैं उस टाइम पे तो कह नहीं पाई, बट अब जब फील होता है तो याद आता है कि हाँ मुझ में कुछ प्रॉब्लम थी, मैं शायद कुछ ऐसी हूँ, लोग मेरे साथ नहीं रहना चाहते। सो बहुत सारी चीज़ें थी।
तो ऐसे लगता था कि लोग आपको डिसेबिलिटी से पहले देखते थे और इंसान से बाद में देखते थे।
एक टाइम था डिसेबिलिटी की वजह से तो मैं को डिसअपॉइंटेड थी, पर आज मुझे आप बोलो तो मुझे नहीं। आपको मैं एक चीज़ शेयर करना चाहूँगी। डिसेबिलिटी नाम है और अभी आप अगर उसे मानते हो तो बस हाँ लोग समझते हैं पहचान है हमारी, पर मुझे नहीं लगता वो मेरी पहचान है। मेरी पहचान है इंडिया की बास्केटबॉल कैप्टन है, जिसकी वजह से मैं आज आपके सामने स्पोर्ट्स में आने के बाद मैंने पैराग्लाइडिंग किया, वॉल क्लाइंबिंग किया 42 फीट, स्विमिंग करती हूँ। हैंडबॉल तो जस्ट ऐसे ही खेल लिया था, उस टाइम फ्री थी तो पैशन है, मतलब मुझे अलग अलग एक्टिविटी करना पसंद है, सो मैं करती रहती हूँ। आज भी एक सपना है कि जाके आगे स्काई डाइविंग करूँ, पर डेफिनेटली कि जाऊँगी जरूर।
So she has actually done all kinds of sports, many sports, and she has done very nice. At state level, national level, and everywhere she is doing very nice. कभी दिमाग में आया था कि उसी स्कूल में वापस जाऊंगी, लेकिन शिकायत लेकर नहीं, कहाँ नहीं लेकर जिन्होंने मना किया एडमिशन?
सर गवर्नमेंट स्कूल में आप जानते हो क्या ही बच्चों को वहाँ पे मोटिवेट के लिए लोगों को बुलाते होंगे। मैं इंतजार तो कर रही हूँ कि स्कूल मुझे वहाँ बुलाएं और एक एज ए चीफ गेस्ट में जाऊँ और मुझे खुशी होगी क्योंकि वहीं से मेरी शुरुआत हुई है, तो इंतजार है उसका।
जब आपने पहली बार खेलना शुरू किया तब आपको डर ज़्यादा लगा कि एक्साइटमेंट लगी?
सच कहूँ तो डर था नहीं और एक्साइटमेंट भी नहीं था। पहले तो लोग ये था कि लोग मजा उड़ाएंगे, स्पेशली फैमिली की ऑलरेडी टूटा फूटा है, कुछ और हो गया, कुछ और इंजरी हो गई तो कौन देखेगा। सो वो डर था। खेलना स्टार्ट करके 6 महीने तक मैंने घर पे बताया नहीं कि मैं खेल रही हूँ।
इसके बाद
फर्स्ट नेशनल खेलने के लिए गई थी तो धीरे धीरे बताया हमको कि मैं स्पोर्ट्स खेल रही हूँ, पर
को पता नहीं स्पोर्ट्स क्या होता है, व्हील चेयर में बास्केटबॉल खेलना क्या होता है, क्योंकि आप जानते हैं कि पैरा स्पोर्ट्स को मैं भी शायद 10 साल पहले कोई जानता ही नहीं था, आज लोग जानते हैं, उनके मेडल्स आ रहे हैं। सेम वैसे था मेरा भी कंडीशन कि लोग मुझे ना, मैं खुद एक पैरा स्पोर्ट्स को नहीं जानती थी, और व्हील चेयर बास्केटबॉल क्या है तो क्या ही मैं फैमिली को एक्सप्लेन कर पाऊँ।
जैसे से खेलने लगे तो आपको इंटरेस्ट क्या आ गया?
जब खेलना स्टार्ट किया ना तो मुझे आइडिया नहीं था कि मुझे कहाँ जाना है, क्या करना है, नेशनल खेलना है, इंटरनेशनल जाना है, किसको दिखाना है, किसको नहीं दिखाना है। मुझे ऐसा लगा मुझे शायद कुछ नया सीखने मिलेगा। मैं अपने आप को पुराने माहौल से निकालना चाहती थी। सो मैंने ज्वाइन कर लिया और धीरे धीरे स्टार्ट किया तो मज़ा आने लगा। जो मुझे लाइफ का किक चाहिए था मुझे वो वहाँ मिला, और मेरी लाइफ होते ना, जो सोसाइटी में रिस्पेक्ट और इज्जत नहीं थी, सोसाइटी में कोई बुलाता नहीं था, आज काफ़ी अच्छी बात है।
That's really nice. हर एक एथलीट का एक मेंटल रूटीन होता है, जैसे विजुअलाइज करना, एक्सरसाइज करना, आपको अफर्मेशन देना। आपका मेंटल रूटीन क्या है? अगर आप चालू खेलें तो उसके लिए क्या है?
पहले तो ऐसा था नहीं, बट शायद से अजीब लगे, मैं आजकल इंस्टाग्राम पे रील्स देखती हूँ। मैं स्टार्ट होने के पहले या एक दिन पहले या मैं मैच देखूँ, उसको डेवलप करूँ, उसकी वजह मैं भी अपने आप को उस फोकस में लाने के लिए, बिकॉज मेरा अलग रूटीन है। मैं अगर मेंटली खुश हूँ और मज़ा करके खेल रही हूँ ना तो उस गेम पे मैं अच्छा परफॉर्म कर जाती हूँ। मेरा हमेशा से मेरे खुद की मैंने नोट किया है। सो मैं मोस्टली रील्स वगैरह देखती हूँ, एंजॉय करती हूँ उस टाइम को, और टीम के साथ गेट टुगेदर करना, मस्ती करना, मैं बहुत मस्ती करती हूँ टीम में, तो मुझे उसका रिजल्ट मेरे परफॉर्मेंस में दिखता है, तो मैं उस हिसाब से कोशिश करती हूँ जो मुझे अच्छा लगे।
मैच से पहले नर्वसनेस होती है, लेकिन एंजाइटी कभी कभी परफॉर्मेंस फील बनती है। आप एंजाइटी को कैसे लेते हो? आपके फ्रेंड या दुश्मन?
जनरली इस मैच के टाइम पे जो प्रेशर है, अभी तो नेशनल का प्रेशर आता नहीं है मुझे, मैं सोचती हूँ कि नेशनल लेवल में जुड़ा रहे। मेरी महाराष्ट्र वुमेन्स टीम ने 5 टाइम बैक टू बैक नेशनल गोल्ड मेडल जीता है, और 2024 में मैं नेक्स्ट लेवल में टूर्नामेंट आई हूँ, और उस टाइम पे महाराष्ट्र टीम की कैप्टन भी थी, और लास्ट 2 ईयर से मैं इंडिया
चेंज हुए थे, फिर भी आप जीती।
यस, और उसके बाद बैक टू बैक मैं 2 साल कंटिन्यू इंडिया टीम कैप्टन रही हूँ, तो अब वो डर नहीं, बस थोड़ा डर होता है इंटरनेशनल में, बिकॉज आप अदर कंट्री के साथ खेल रहे हो, आप इंडिया को रिप्रेजेंट कर रहे हो, वहाँ पे मेरा नहीं आता, वहाँ देश आता है, तो वहाँ पे डर होता है कि हम परफॉर्म करें और मेडल लेके जा सके, बट बहुत सारी बेसिक चीज़ों से हम अभी भी पीछे हैं, तो वहाँ तक पहुँच नहीं पा रहे, बट डेफिनेटली एक दिन जरूर करेंगे।
पक्का है। कैप्टन मतलब सिर्फ स्ट्रैटेजी नहीं होती, साइकोलॉजी भी होती है। तो आप किस तरह के कैप्टन हो? अथॉरिटेटिव हो, सपोर्टिव हो, या ज़्यादा बोला तो कार्य करा तो निकालिए?
जनरली ऐसा नहीं है, मैं थोड़ा सपोर्टिव हूँ। कैप्टनशिप लीडरशिप में मेरा आना कोई सब प्लान था नहीं। मैंने जब 2017 में स्पोर्ट्स स्टार्ट किया था, बहुत सारी बेसिक चीज़ों के लिए मैंने चूज़ किया। मेरे पास एक बेसिक स्पोर्ट्स विचर तक नहीं थी, एक नॉर्मल विचर भी नहीं थी। इनफैक्ट हमने जब स्टार्ट किया था, मैं हॉस्पिटल के विचर में बैठ के खेल रही थी। अब हॉस्पिटल के विचर भी आपको देखा होगा कि कैसे बैट कंडीशन में होता है, उसका स्टैंड यहाँ होता है, ऐसे पुश करना है, तो आप कहाँ बॉल पकड़ोगे, कहाँ पुश करोगे। और मैं इसमें एक चीज़ शेयर करना चाहूँगी कि जब हम बास्केटबॉल खेलते हैं ना, एबल बॉडी की जो हाइट पे बास्केटबॉल कोर्ट होता है ना, उसी हाइट पे बैठ के खेलते हैं, तो वो हमारा अपर बॉडी, अपर स्ट्रेंथ ज़्यादा चाहिए। दूसरा, हम बॉल को लेग पे नहीं रख सकते ज़्यादातर, 2 पुश ही अलाउ है, 2 पुश, तो उस पर रखना है हमें, पुश करें तो कोई भी टाइप कर सकता है, तो वो भी पॉसिबल नहीं है। हमें व्हीलचेयर पुश करना है, ट्रिपलिंग करना है, स्ट्रेट भी नहीं जा सकते। अगर स्ट्रेट जब किसी प्लेयर को क्लैश हुआ तो वो मेरा ही फाउल होगा। मुझे स्पीड लेना है, कट लेना है, मतलब बहुत सारे ऐसे मूवमेंट कंट्रोल करके व्हीलचेयर को जाके उसी पोजीशन में शॉट लेना है। आसान नहीं होता ऐसा, सो बट मज़ा भी आता है। मैं टीम में सबसे फास्टर प्लेयर हूँ, तो मैं लेयर्स के लिए ही ज़्यादातर शॉट लेना पसंद करती हूँ, और मैं उसमें इंडिया टीम में एटलीस्ट मैं ही हूँ कि लेयर्स में बेटर हूँ थोड़ा। बट जैसा आपने क्वेश्चन किया ना सर कि लीडरशिप में ये रहा कि जब मैंने आपको बताया 2017 की जो बेसिक चीज़ें मेरे लिए नहीं रही, मैं कोशिश करती हूँ कि आज जो न्यू प्लेयर्स हैं उनको ये तकलीफ ना हो, उनको वेजेस मिल जाए, उनको टूर्नामेंट के लिए जो एक्सपेंसिव की ज़रूरत है वो मिल जाए, ग्राउंड मिल जाए, बेसिक चीज़ों की कोशिश कर रही हूँ। तो मैं धीरे धीरे मैंने वो स्टार्ट किया। अभी कुछ महीनों पहले मुझे 20 व्हीलचेयर मिली थी, मैंने पर्टिकुलर मुंबई में नहीं हर स्टेट में डिस्ट्रीब्यूट कर दिया जिनको नीड था। सो धीरे धीरे इस चीज़ में आ गई और सडनली मुझे भी फील होने लगा कि शायद मेरे लोगों को मेरी ज़रूरत है, तो मैं वैसा वर्क कर रही हूँ फिलहाल।
बहुत अच्छी बात है। जब कोई खिलाड़ी इमोशनली ब्रेकडाउन होता है तो आप उसको कैसे हैंडल करते हैं?
सबसे पहले तो मैं सॉरी पर गाली देना पसंद करती हूँ, क्योंकि आपकी प्रॉब्लम आपको सॉल्व करना है। आपके साथ एक बार कोई बैठेगा, 2 बार बैठेगा, तीसरी चौथी बार नहीं बैठेगा। वो आपको सिर्फ एडवाइस देगा कि नहीं चला के बढ़ नहीं, बट आपके अंदर जो फाइट होती है वो आपको लड़ना है, आपको उससे बाहर निकलना है। लेकिन आप जब तक खुद नहीं थामोगे आपको कोई नहीं पूछेगा।
एकदम टफ लव वाला स्टाइल।
टफ लव तो सबसे ज़्यादा सर लॉकडाउन था, उस पीरियड्स में मुझे कैंसर के सिम्टम्स हो गए और मैं डर गई थी। तो मुझे वहाँ से बाहर निकलना, मुझे लगा मैं गई। फिर मेरे दोस्तों ने मुझे काफ़ी सपोर्ट किया और मैंने बोला नहीं, गिव अप यहाँ नहीं करना है, यहाँ तो नहीं, एटलीस्ट मेरे दोस्तों के लिए बने। तो वहाँ पे कम्बैक मेरा बहुत अच्छा था, मैं ठीक होके निकली। और उसके साथ एथलेटिक प्लेयर भी हूँ, रनिंग करती हूँ, व्हीलचेयर रेसिंग 100 मीटर 200। तो उसमें जो कम्बैक था मेरा, हमारा एक इंटरनेशनल हुआ दिल्ली में, वहाँ पे हमने सिल्वर मेडल जीता नेपाल के साथ। फिर एथलेटिक में जैसे मैंने बताया 100 मीटर कर रही हूँ मैं 200, तो व्हीलचेयर रनिंग करना स्टार्ट किया था। उसमें मैंने उड़ीसा में 2 मेडल्स लिए एथलेटिक में, और उसके बाद खेलो इंडिया के लिए सिलेक्ट हुई। खेलो इंडिया में भी महाराष्ट्र के लिए मैंने एक गोल्ड और एक सिल्वर जीता। देन बैक टू बैक 2023 और 24 में मेरा टॉप स्कोरर रही बास्केटबॉल में। सो बैक टू बैक मैंने गिव अप नहीं किया, मेरा फूड फ्लो अच्छा था और मैं करती आई हूँ। तो जो मेरा कमबैक था, मुझे लगा कि मैं पीछे नहीं रह सकती और पीछे जा नहीं सकती।
मेंटली और फिजिकली दोनों तरफ से कर रहे हैं
सर। मेंटली जैसे बताया मैं खुद ही करना है, तो मेंटली मैं भी डिस्टर्ब होती हूँ। ऐसा नहीं कि कभी कभी लगता है 2 दिन के लिए भाग जाओ, रिसोर्ट जाओ वहाँ पे बैठो अकेले, फिर थोड़ा लो फिर हंस लूँ, फिर अपने में एंजॉय कर लूँ, फिर देन कम बैक। ये ऑप्शंस नहीं है।
तो 2 साल प्रैक्टिस डाउन नहीं थे, थोड़ा सपोर्ट और किसी तरह, और फिर भी 5 नेशनल गोल्ड मेडल मिले। वो ऐसी क्या सोच थी जो आपको इतना फाइट करने के लिए आगे लेके गई?
सर ये सबसे बड़ा प्रॉब्लम ये था कि 23 में हम कलिना यूनिवर्सिटी है ना, वहाँ पे प्रैक्टिस करते थे। 5 साल हमने प्रैक्टिस किया। हमें पास पैसे इतने नहीं कि पर डे ग्राउंड का हम 1 लाख रुपया पे कर सके। तो वहाँ के एक मैम थे, उन्होंने सपोर्ट किया और हमें ग्राउंड दिया था। उन्होंने काफ़ी बार एक्टिविटी वहाँ शुरू की, बट शायद वहाँ पे कुछ लोगों को पसंद नहीं था। सो कुछ इश्यूज हुए और हमें वहाँ पे बंद कर दिया गया। मैं आज 3 साल से ट्राई कर रही हूँ कि वो कोर्ट हमें वापस मिले, बिकॉज इंडोर स्टेडियम है। इंडोर स्टेडियम में इसलिए बिकॉज सर हमारी व्हीलचेयर्स 8-8 लाख की है। अगर मैं आउटडोर कोर्ट में खेलती हूँ 6 महीने में स्पॉइल हो जाएगा, और बार बार उसे बाहर करना हमारी कैपेसिटी नहीं है। हम यहाँ स्पॉन्सर्स मांग के लाते हैं, उससे मैनेज करते हैं। अब मुझे मेरे स्टेट में अगर कोर्ट ना मिले और गवर्नमेंट का सपोर्ट ना मिले तो फिर मैं क्या बोलूँ सर। मैं आज बहुत डिसअपॉइंटेड हूँ। मैं 3-4 महीने पहले सीएम के पीए को मिल के आई हूँ, उनको मैंने रिक्वेस्ट लेटर दिया। उस लेटर पे सीएम का सिग्नेचर्स भी आया, वहाँ से अप्रूव भी हुआ कि आपको उन्होंने कलिना पर लेटर भी शायद भेजा है कि आपको हमें ग्राउंड देना। फिर भी उसके बाद वो कलिना यूनिवर्सिटी वाले हमें लड़ रहे हैं कि व्हीलचेयर से ग्राउंड खराब होता है। जब अपने लोग ही अपने को साथ नहीं देंगे तो देश के लिए कैसे मेडल आएगा। तो सोचना जरूरी है। मैं आज भी स्ट्रगल कर रही हूँ और कोशिश कर रही हूँ सीएम को पर्सनली मिल सकूँ, मुझे अपॉइंटमेंट मिल जाए। मेरा एक ही टारगेट है, सबसे पहले महाराष्ट्र वुमेन्स टीम को वहाँ पे कोर्ट दिलाना।
जब आप इंडिया की जर्सी देखते हो तो आपको अंदर से आवाज़ क्या आती है? बहुत प्रेशर है, आई वाज बोर्न फॉर दिस।
सर मैं थोड़ा बैक जाऊँगी। मेरा बचपन से सपना था एक कि मैं फौज में जाऊँ, और इस कंडीशन में तो फौज में कुछ काम नहीं होगा मेरा। जब स्पोर्ट्स में आई ना तब मैंने सोचा नहीं, शायद भगवान ने मुझे दूसरा रास्ता दिया है। मैं कुछ दिन पहले नेवी ऑफिस में नेवी के इसमें मलाड में गई थी, INS हमला एज ए चीफ गेस्ट। जब मैंने उनका जो यूनिफॉर्म था और मेरा ये यूनिफॉर्म, मुझे उस टाइम पे थोड़ा इक्वल लगा। प्राउड फील हुआ। बस रास्ते अलग थे, सपने आज भी वही है, देश के लिए मेडल लाना और उसे पूरा करने के लिए पूरी जाना
Really nice. अगर कल खेल ना रहे तो गीता कौन है?
सर मैं खुद भी नहीं पहचान पाऊंगी मैं कौन हूँ। विदाउट स्पोर्ट्स आज मैं इमेजिन करूँ तो मुझे नहीं लगता मैं वो लाइफ जी पाऊंगी जो जी रही हूँ अभी।
Fine. So कुछ रैपिड फायर क्वेश्चन। मैच से पहले फेवरेट डोपामिन बूस्टर क्या है? म्यूजिक, फूड, टीममेट, गॉसिप?
म्यूजिक।
किस टाइप?
थोड़ा फनी टाइप, थोड़ा एंजॉय टाइप।
एक टीममेट जो हमेशा आपकी बात नहीं मानता हो?
ठीक है, और हर एक टीम में कोई तो एक ऐसा प्लेयर होता है तो है, हमारे यहाँ पे भी नहीं है, पुणे में एक है रीना गुप्ता।
अपोनेंट देखकर कभी ऐसा लगा कि आज इनको थेरेपी की जरूरत है, मुझे नहीं?
सर इस बार नेशनल एक हुआ था कुछ थोड़ी, हम अभी हमारा ग्रोथ यहाँ पे हो रहा है, हम ऐसा परफॉर्म कर रहे हैं महाराष्ट्र की स्पेशली। अब इस बार हम नेशनल गए थे, बहुत सी ऐसी टीम थी जिनका ग्रोथ यहाँ की जगह यहाँ आ रहा है। सो मैं उनके साथ क्या ही फाइट करूँ, और फाइट का हो रहा था मेरी, मतलब वहाँ हंसी आ रही थी। अब सर मैं आई एग्री कि वो न्यू प्लेयर्स है या कुछ है तो मैं उनको जबरदस्ती फाइट नहीं कर सकती, मुझे भी थोड़ा फील होता है क्योंकि हम भी प्लेयर ही है, वो भी प्लेयर है। तो मैं जब उनके पास नहीं जा रही थी तो मुझे पीछे से कोचेस के डांट पड़ रहे थे, ये क्या कर रही हो अनु, क्यों नहीं जा रही हो ये वो। और जब जाने लगी तो मुझे हंसी भी आ रही, प्लीज बॉल दे दो, मैं मांग रही हूँ, मैं छीन नहीं रही थी, मैं मांग रही थी। तो थोड़ी चीजें हुई कॉमेडी टाइप इस बार, बट अभी क्या है करते, मैच था, मैच के दौरान जो पॉसिबल था हम कंट्रोल करके खेलने की कोशिश कर रहे थे।
मैच जीतने के बाद कंफर्ट फूड क्या आपका?
चाय, फूड से ज्यादा चाय पसंद करती हूँ।
वो देखो लिखो से सबसे इरिटेटिंग एवरेज क्या है? इरिटेटिंग एवरेज
एक्चुअली इरिटेटिंग मुझे कोई कर नहीं पाता है, मैं ही लोगों को करती हूँ। मेरी टीम में मेरी फ्रेंड है बेटा, मैं बहुत इरिटेट करती हूँ उसको।
आज भारत में लाखों बच्चे, लड़कियां और स्पेशली एबल्ड यूथ सोच रहे हैं कि क्या मैं ये कर सकता हूँ, नहीं कर सकता हूँ। भारत में लाखों बच्चे जो स्पेशली एबल्ड हैं, वो सोचते कि वो खुद कर सकते, नहीं कर सकते, उनको आप क्या कहना चाहोगे?
पहले तो घर से निकले, क्योंकि उन लोगों ने अपने आप को घर पे बांध रखा है, स्पेशली फैमिली ने, और उन्होंने एक कंफर्ट जोन बना रखा है। मैं यहाँ से यहाँ नहीं जा सकता, गया तो मुझे कोई चाहिए, और अगर गया तो वहाँ पे वॉशरूम है, वहाँ व्हीलचेयर है, नहीं होते कभी कभी। आप जानते हैं एक्सेसिबिलिटी बहुत इश्यूज है, हमें घर से निकलने पहले तो सोचना पड़ता है कि वहाँ पे जा रही हूँ मैं, 5 घंटा रहूँगी तो वॉशरूम है, और अगर वहाँ पे स्टेप्स है तो मुझे उठाएगा कौन, और मैं किसी को तो नहीं कह सकती ना मुझे उठाइए, कंफर्टेबल नहीं लगता है, तो एक्सेसिबिलिटी बहुत ज़रूरत है। सो मैं पहले तो उनको कहूँगी जो घर पे बैठे बाहर निकलिए, अपनी लाइफ को जिए, चलाइए नहीं।
लिमिट क्या आगे, अपनी लिमिट क्या आगे। ऑडियंस में किसी को कुछ क्वेश्चन पूछना है?
आपका डेली रूटीन क्या है?
मैं सबसे पहले मैं बताऊंगी कि मॉर्निंग में उठ के तो मैं थोड़े डॉगीज की वीडियो देखती हूँ, माइंड रिफ्रेश होता है मुझे पेट्स बहुत पसंद है। सो उसके बाद थोड़ा योगा होता है, फिर मेरा जो डाइट वगैरह है वो लेना, फिर जिम जाना, जिम के यहाँ पे जाके फिर थोड़ा देर लंच की तरह कुछ करके डाइट लेके, देन मेरा स्विमिंग है, स्विमिंग के बाद फिर फिजियोथेरेपिस्ट कुछ शोल्डर ट्रीटमेंट चल रहा है मेरा, तो वो है तो पूरा दिन आधा यही निकल जाता है। हाँ, अगर कुछ इवेंट्स है जैसे मैं आज यहाँ पे हूँ तो वहाँ जाना पड़ता है, और फिलहाल इंजरी है तो मैं प्रैक्टिस मैंने स्टॉप किया है, रेस्ट की ज़रूरत है। और ग्राउंड अभी है नहीं तो सैटरडे संडे की उम्मीद रहती कि जो ग्राउंड मिला है वो वीकली खाली हो तो हम प्रैक्टिस कर पाए, मैं तो कभी कभी वो भी नहीं मिल पाता।
आप अपना मोटिवेशन कैसे रखते हैं? इतना जबरदस्त आपने काम किया है, यू आर कंटिन्यूअसली डूइंग इट।
सो मेरे पास ऑप्शंस नहीं है, मेरे पास जो है मुझे उसी में करना है, बेस्ट करना है। अगर मैं ऑप्शंस ढूंढने जाऊंगी तो शायद मैं घर पे ही बैठी रहूंगी।
बोलूँगा मैम हम भी इंडियन क्रिकेट स्पेशली टीम ने वर्ल्ड कप जीता है जस्ट रिसेंटली आफ्टर 3 days बैक जो इट वाज द फर्स्ट टाइम जब स्पेशली इंडियन ने वर्ल्ड कप लाई है वुमेन्स टीम। तो आप क्या सोचती हैं हाउ बास्केटबॉल में इंडियन स्पेशली टीम कब अचीव कर सकती है फ्यूचर आपको क्या लगता है?
सर जैसे आपने बताया कि उन्होंने टीम जीता जो वर्ल्ड कप, मुझे भी बहुत अच्छा लगा था कि हम में से कोई तो आगे बढ़ रहा है, बट वो बढ़ने के बाद का सिचुएशन आपने पूछा नहीं होगा उनको क्या मिला है, उनके पास ग्राउंड है नहीं है, वो किस बैकग्राउंड से आ रहे हैं, उनके पास डाइट करने के लिए जो फूड होते हैं वो है क्या, मतलब बहुत सारी बेसिक चीज़ें सब जब तक आपका ओलंपिक मेडल नहीं आता आपको कोई नहीं जानता है। और आपकी वैल्यू यहाँ से यहाँ इतनी ही है। मैं आज इंडिया के कैप्टन रोबोट में इतनी हूँ क्योंकि मैं आज भी बेसिक चीज़ों के लिए लड़ रही हूँ। हमारे इंडिया में आपको तभी पूछते जब तक आप फेमस नहीं होते हो, या तो इंस्टाग्राम पे या तो कहीं और, उससे ज़्यादा कुछ नहीं। और मुंबई में मैं जब से हूँ मुझे गवर्नमेंट से सपोर्ट अभी तक, सॉरी टू दैट, बट मैं फील करके बोल रही हूँ क्योंकि मैं आज सर्वाइव कर रही हूँ। मैं 2023 में मेरा खेलो इंडिया में एक गोल्ड वाली सिंगर आया था, उस टाइम पे मेरे मेंटर भी मेरे साथ थे। वहाँ पे खेलो इंडिया में मैंने महाराष्ट्र टीम के लिए जीता, वहाँ पे अनाउंसमेंट हुआ कि मुझे 8 लाख मिलेगा। तब मैंने सोचा हाँ मेरे पास बेसिक वेंचर है, 8 लाख मिलेगा तो मैं आगे इंटरनेशनल के जो स्पोर्ट्स इक्विपमेंट की जरूरत है मैं उसे बाय करूँगी क्योंकि उसकी कीमत 11 लाख की है। सो वो आज तक नहीं मिला। तो आप सोचिए इंडिया में हम पैरा स्पोर्ट क्या ही ग्रोथ करें। सॉरी
Any other question?
हेलो, मेरा नाम अमृता देशमुख है, मैं स्पोर्ट्स साइकोलॉजिस्ट हूँ और रिसेंटली ओलंपिक से पहले हम कुछ पैरा शूटर्स से मिले थे जहाँ पर उनको लेके जाने वाले जो उनके फैमिली मेम्बर्स है या जो भी है उनके साथ इवेंट में रुकते हैं उनके इमोशंस के बारे में भी हमने जानने की कोशिश की थी। तो आपके इवेंट के टाइम आपके कोई फैमिली मेम्बर आपके साथ होते हैं और उनके इमोशंस आपके सक्सेस और फेलियर रिलेटेड कैसे आप मैनेज करते हो अपने आप के साथ?
मैम जैसे आपने बताया कि फैमिली बास्केटबॉल में मैंने एक चीज़ सीखी, हमें हमारी फैमिली बुलाना अलाउ नहीं है। सो हमें खुद पर डिपेंडेंट रहते हैं। हम डेली रूटीन का काम भी वहाँ पे कैंप में खुद ही करते हैं, खुद के कपड़े धोना, खुद सब मैनेज करना। कभी कभी हम वॉशरूम में भी गिर जाते हैं तो एक दूसरे को हेल्प करके। तो यहाँ पे मैं सेल्फ डिपेंडेंस सीखी हूँ बास्केटबॉल में आके। और मुझे कभी ऐसा फील नहीं हुआ कि मैं किसी पर डिपेंडेंट नहीं रहना चाहती हूँ कि मैं अगर मुझे यहाँ जाना है तो मेरे घर से कोई आएगा और वो चलेगा तो ही मैं जाऊँगी। अब कौन करेगा मेरा, आप बताइए। एक बार या 2 बार सिस्टर थी मेरी, उनकी शादी हो गई, वो अपने घर, आज भाई है, भाभी है, बच्चे उनके, उनकी अपनी फैमिली, मॉम है, उनकी एज हो गई है तो उनको तो मैं मना नहीं सकती। सो मैं कोशिश करती हूँ खुद पर डिपेंडिंग रह के, और मुझे भी ज़रूरत नहीं लगती। मैं पूरी इंटरनेशनल लेवल पर अकेले ही घूमती हूँ। सो टीम रहती है, सब मैनेज हो जाता है। और जैसे कि आपने बताया कि अचीव होने के बाद जो फैमिली का रिएक्शन है, और फैमिली का रिएक्शन तभी आता है जब तक आप यहाँ से यहाँ नहीं बढ़ते हो। नहीं तो घर में आप एक कोने में रहो, आपका वैल्यू उतनी है। पेरेंट्स में मॉम डैड समझ सकते, बाकी भाई बहन मुझे नहीं लगता इतना। जो समझ गए वो समझ गए, जिन्होंने नहीं समझा तो पता चले। बट वो जो अचीव करना होता है ना, वो बहुत मायने रखता है। मेरे घर में मेरी वैल्यू हमेशा 0 रही, और जब मैंने अचीव किया और मीडिया वाले घर पे आए थे इंटरव्यू लेने के लिए, BBC न्यूज़ और वाले, तो घर का रिएक्शन दिखता है, तब वहाँ पे दिखता है कि हाँ मैंने कुछ तो किया है। थैंक यू सो मच।
एक और बात मैं आपसे पूछना चाहूँगा गीता जी, कुछ चीज़ें मैंने आपके बारे में पढ़ी जिसमें आपके बायोडाटा के बारे में, जिसमें जिक्र था कि आप इंडियन बास्केटबॉल टीम की कैप्टन है, नेशनल लेवल पे हमारे देश को रिप्रेजेंट करती हैं। दूसरी बात ये कि आप टेनिस प्लेयर भी हैं, महाराष्ट्र को रिप्रेजेंट करती हैं। और साथ में एक चीज़ और भी पढ़ी जो थोड़ी सी दिलचस्प लगी मुझे कि आप एक एंटरप्रेन्योर भी हैं, एक गारमेंट शॉप भी आप चलाती हैं, आपका उसका भी एक बिजनेस है। तो मेरी क्यूरियोसिटी इन तीनों बातों को लेकर ये है कि अपना काम, अपना पैशन, इन सारी चीज़ों को बैलेंस लेवल पर रखना और इसके लिए वक्त निकालना, ये कैसे मुमकिन हो पाता है, या फिर आप उन चीज़ों को किस नज़रिए से देखते हो और मैनेज कर पाते हैं?
सबसे पहले जो मैं टेनिस खेलती थी 2018 में, मैंने वो 21 में क्लोज किया, क्योंकि सेम चीज़ मेरे पास ग्राउंड नहीं था, कोचेस नहीं थे। मैंने उसे कंटिन्यू करने की कोशिश किया, बट मुझे सपोर्ट मिल नहीं पाया, तो वो मैंने स्टॉप किया और एथलेटिक में आ गई। बिजनेस मेरा काफ़ी स्पोर्ट्स से स्टार्ट होने के पहले से बिजनेस था। मैं वुमेंस डिज़ाइनिंग वगैरह का वेडिंग कलेक्शन करती हूँ। अगर आपने शादी नहीं की हो तो मैं आपको डेफिनेटली शेयर करना चाहूँगी। तो उस कपड़ों को मैंने सेल किया और अपना एक पॉकेट मनी सब, मतलब स्पोर्ट्स का आधा खर्चा मेरा वहाँ से स्टार्टिंग में हो जाता था। बट लॉकडाउन में सब कुछ खत्म हो गया, और लॉकडाउन में मेरा शॉप बंद हुआ क्योंकि रेंट पे था, तो पे करना उस सब। और मेरा ट्रीटमेंट स्टार्ट हुआ तो मेरे लिए बहुत ही मुश्किल था। पहले तो ट्रीटमेंट से बाहर निकलना, और मेरे मुझ पे एक लोन था जो मेरे ट्रीटमेंट के दौरान हो गया। सो मुझे मेरा वो बिजनेस स्टॉप करना पड़ा, और मैंने खुद के लिए कर लिया था, मुझे सेल करना पड़ा उसे क्लियर करने के लिए, क्योंकि मुझे पता नहीं था मैं आगे रहूँगी या नहीं रहूँगी। तो मैं किसी और का बर्डन, मतलब किसी और को तकलीफ लेके नहीं जाना चाह रही थी, इसलिए मैंने वहीं पे स्टॉप कर दिया। और 2022 के बाद मैं कंटिन्यू नहीं कर पाई क्योंकि उतना फाइनेंशियली स्ट्रॉन्ग नहीं थी। बट स्पोर्ट्स का पैशन इतना बढ़ गया कि मैंने बोला इसी को करियर बनाऊंगी, और इसी में घुस गई पूरी तरह से। तो आज भी फोकस वही है, बट जब स्पोर्ट्स में से रिटायरमेंट होगी तो बिजनेस में फिर से कम जरूर करूँगी।
So, ladies and gentlemen, not a wheelchair athlete but an unstoppable mind, Captain Geeta Chouhan.
So, when we were conceptualizing the whole idea of this program, we knew that we wanted an athlete to share their lived experience. And there were many athletes who we thought of and we were in touch with. But in my heart, I knew that इनकी जो स्टोरी होगी, जो व्हीलचेयर पे बास्केटबॉल जब वो खेल रहे हैं, that is going to be the true story of grit and courage and her life. जितना भी हमने सुना, it has been a story of grit. मतलब इतने hurdles आए हैं, लेकिन किसी ना किसी तरह उसको पार किया है. As a psychiatrist, we value such an experience more than that of a top-notch cricketer or that of a top-notch any other star player, Messi लाओ, रोनाल्डो लाओ, विराट कोहली लाओ, लेकिन हमको ये सुनने के बाद जो हम inspired feel हो रहे हैं, that cannot be matched. And your story has been so inspiring, especially जो struggle हमने सुना, आपने जो कहा, ये हम देखते हैं इंटरव्यूज में भी कई बार आता है कि पानी पूरी बेच रहे हैं कहीं पे वगैरह. And a lot of us want to do, but कई बार नहीं कर पाते हैं. But that's not the story here. Fortunately, after hearing your story and knowing that there's so much difficulty, गुजराती में हम कहते हैं फूल नहीं तो फूल नहीं पाखड़ी से ही, means अगर flower नहीं तो उसका petal at least. So Jagruti Rehabilitation Center has decided to I don't know what would be a good word, but to honor your achievements with an amount of 25,000 rupees. डेफिनेटली आपके अचीवमेंट्स और बढ़े और उसमें किसी तरह कंट्रीब्यूट कर सके जागृति रिहैब इस इंटेंट से दी गई है. सो प्लीज डॉक्टर अमर शिंदे सर, इफ यू वुड ऑफ कोर्स प्लीज आइए. दिस वाज अनदर प्लान थिंग, सो वी डोंट हैव अ चेक और एनीथिंग टू गिव यू राइट नाउ. या सर,
don't have a check, but
we have all the intent right now, sir. Yeah, आपको देख के और लोगों को इंस्पिरेशन आएगी in future में भी. So again, everyone, a big round of applause to Dr. Abhishek sir and Jagruti Rehab.
would like to request Mansi ma'am to kindly felicitate Geeta ma'am.
Thank you so much for
जीत हार से ऊपर एक ही होती है पहचान, यहाँ हर खिलाड़ी में हमारे भारत देश की शान।
And I would like to request Shobha ma'am to kindly felicitate Arkesh sir, please. My pleasure.
संघर्ष काफी बड़ा शब्द है। इसके मायने हर एक इंसान के जीवन में अलग अलग तरीके से उभर के आते हैं। कोई अपनी निजता के साथ संघर्ष करता है, खुद को साबित करने के लिए, खुद की इमेज को बनाने के लिए। जब ये संघर्ष पूरा हुआ है, ऐसा लगता ही है कि उतने में उसके सामने समाज व्यवस्था एक बड़ी चुनौती बन के आती है। समाज से संघर्ष पूरा होने ही वाला है, उतने में ही एक व्यवस्था हमारे सामने एक बड़ी खंडहर की तरह एक बहुत बड़ा ऑब्स्टेकल बन के हमारे सामने आ रहा है। लेकिन उसके बावजूद गीता जी जैसे हमारे देश के कुछ बेहतरीन और होनहार खिलाड़ी इस संघर्ष को जारी रखते हैं, हम सब लोगों के लिए मिसाल बनने की। संघर्ष इंसान के लिए नया नहीं है और इसी वजह से ख्यातनाम कवि हरिवंश राय बच्चन जी ने कविताओं की कुछ पंक्तियां बताई थी कि तू न थकेगा कभी, तू न रुकेगा कभी, तू न मुड़ेगा कभी, कर शपथ कर शपथ कर शपथ, अग्निपथ अग्निपथ अग्निपथ। यह महान दृश्य है, चल रहा मनुष्य है, अश्रु स्वेग खून से लथपथ लथपथ लथपथ, अग्निपथ अग्निपथ अग्निपथ। That story of greed and spirit was heart-moving and powerful.
Every athlete's journey is a reminder of resilience humans are capable of. And with that, we move on to the second last session of the day. And I would like to request I'd like to request Dr. Sujoy and Dr. Save to please chair the session.
But you can share or chair.
Dr. Sujay Prabhuram sir is a psychiatrist with 15 years of experience in the clinical psychiatry, psychotherapy and corporate wellness. He works as a consultant at Mindspire Psychiatry Clinic, Mumbai, independent practice since 2010 to present. A one-stop solution for all psychological issues. He is an honorary consultant in Bhakti Vedanta Hospital, Mira Road, since 2009 till present. Manages inpatient and outpatient psychiatric services. He is having teaching responsibilities for nursing as well as DND students. He has organized a hospital mental health license procurement in 2016. He has conducted multiple public and corporate mental health programs. Also, he ran full marathon twice in Jeevan, half marathon in Ladakh, and regularly running marathons since career. I have run triathlons and competition swimming. Such a wonderful and dynamic person.
We welcome you, sir. And the other chairperson we have here is Dr. Devendra Save, sir, who's a consultant psychiatrist practicing since the last 27 years in Mumbai. He's a director with 3Q Medicare and Vivas Neuropsychiatric Hospital. He's attached with Bhakti Vedanta Hospital, Mira Road. We welcome you, sir.
Thank you.
If I may, that's a really short introduction, but आप मतलब किसी को भी मकाबो एरिया जो है ना, वहाँ पे अगर किसी को, if you just want to know who is the psychiatrist who you want name, None of us exist, it's only Save sir over there. It is quite a big personality that side.
You know Mansi and how she feels. All of you have to
Tone it down.
Now that our chairpersons are here, I would like to request them to introduce our next speaker, Dr. Sarika ma'am.
Dr. Sarika Awardee, she's an associate professor and head of Department of Psychiatry, Grand Medical College, Mumbai. Deputy Superintendent, Gopaldas Special Hospital, Mumbai. Nodal Office, Addiction Treatment Facilities, St. George Hospital. Nodal Officer, Drug Treatment Unit. State Coordinator for Student Wellness Program. Member of Narcotics Use Prevention Transformation Coordination Committee. Member of Ethics Committee for Academic Research. Deputy Superintendent. She has various qualifications and various accolades for Congrats and she has won a lot of awards and prizes. Also, E.V. Shah Best Paper Award 2004 for research paper, study of violence among patients suffering from alcohol use disorder. L.P. Shah Best Paper Award 2012 for research paper, study of psychiatric comorbidity and its correlation with various social demographic and clinical factors in women attending antenatal clinic and tertiary care unit. Secured 38th rank in national level competition by Addiction Psychiatry Society for third rank national level competition for Addiction Psychiatry Society of India for presentation on methamphetamine use disorder in middle-aged women. Okay, let's go for the methamphetamine. Conducted national level workshop in NDPS Act 1985 in ANSEMS in 2022 at Vishakhapatnam. Invited as speaker at various national level conferences and CABs. They have lots to learn from you, ma'am, Dr. Sarika Awardee.
Before we begin, I would like to know how many of us are working as in the field of sports psychiatry or sports psychology. And how many are psychiatrists or related mental health professionals? Thank you for that. Geeta, on behalf of you, may I appeal something? Is it okay with you if I appeal something on behalf of you? Yeah. So I appeal to all the pharma companies who are sponsoring, please think of your CSR to sponsor the team of the Paralympic basketball team. We have the captain here and you heard the story. So please propose to your respective countries. Thank you. Yeah, so Boxo and sports. Audible? Yes. So let's begin. I think we are nearing the end, so post-lunch session, so I'll try to keep you all as much as possible. So let's go to the case vignette to start with. We have a 17-year-old girl. She's a captain of our elite volleyball girls team. Socializing with her 19-year-old boy who is a captain of the team from the same club. After the practice, they generally would walk down home as their fathers were neighbors and were best buddies for decades. One day, she returned home, appeared anxious, tearful. When her parents asked her, she told them she lost her wallet and so she was scared. When her 20-year-old sister, who would share a room with her, noticed that she was sleep-talking and she woke up perplexed. Upon confronting her, she narrated the incident of molestation by the same boy in the dark alley while returning home, and she also told her sister that not to inform anyone, especially the parents, about it. She was scared that her parents won't believe it or may make an extreme scene out of it. She was anxious about how it will affect her game career, her image in the club, or her neighborhood relations. So what do you think the sister should do? Any thoughts?
Inform the parents. She's a minor.
Inform the parents. Okay. So let's move on to our second case now. 14-year-old boy representing state in basketball was attending residential training camp for 2 weeks. The boy noticed that the team assistant was inappropriately touching few of the boys, and the response was varied. Few would ignore, few would shy out, few would avoid, few would be very angry and helpless. One of the days, the boy experienced similar inappropriate touch to his private part while he was using a urinal. For remembering the lesson from the childhood, bad touch, the disturbed boy reported this to his mother, who was in her hometown. So training camp was around 600 kilometers away from hometown. The father was on some business trip. So what do you think the mother sitting in the hometown should do? Okay, that is what brings us to POCSO. Protection of Children from Sexual Offences Act 2012. So what are the highlights of this act? The gender, the age is below 12 years, whom we generally call as minor. Gender can be any. It may not be a boy, a girl, or somebody who is identifying themselves as a quiver or anything from the LGBTQ community to start with. Sexual act can be penetrative, non-penetrative. It can be sexual harassment or child pornography. All of it has been covered in the act. The child-friendly approach during the investigation has been encouraged and is to be followed by the investigating officers. The statements will be recorded or should be recorded in a safe and supportive environment in the presence of trusted adults. Strict prohibition of disclosing the identity of victims. We have seen this in Nirbhaya case also, because I think the POCSO is a result of another result of Nirbhaya. And there is a collective responsibility of the society to protect children and prevent abuse. So this is what it is. Now the main highlights are: reporting is mandatory. There is no act of omission in this. It will not be considered as a legal action if there is an act of omission. Any individual who is aware of the case must report. So whether it is the sister, whether it is the mother, they are supposed to report. Do we want to verify if the child has told us the truth or not told us the truth? How do we do that? We'll come to that. So anybody who is parent, teacher, coach, doctor or any citizen knows about it must report. Failure of obligatory reporting will have legal consequences on the people who are not reporting. The key offences are somebody touching private parts of the child, makes the child touch their private parts, or engages in other physical acts with sexual intent that does not involve penetration. Now there is one more term, that is aggravated sexual assault. It is by a trusted person or by an authority figure or targeting a vulnerable child, or there could be repeated assaults. So the important terms which are also covered are sexual harassment, which can be verbal or non-physical act of sexual nature, and child pornography, that includes storage, distribution or creation. This law somehow is very explicit and very defining compared to all other laws that we have. They have hardly left any loopholes, and the responsibility lies on the perpetrator to disprove that this has happened. So when to suspect that a child could be facing sexual abuse? With the behavior and the emotional responses that the child has, it could be rigorous behavior, acting out, like throwing temper tantrums or avoiding certain things, pseudo-natural behavior. Suddenly they behave all best. They have school difficulties which were not there before, isolation or withdrawal. There could be physical indicators, for example, injury, which are unexplained. So the child tries to give some explanation, but it is not fitting into the norms. Physical evidence of harm without any reasonable explanation, and signs like pain, itching, bleeding, or torn clothing. What are the other red flag signs? The riskier behavior or the emotional distress that can be observed, which could be self-destructive tendencies, can be observed. Sexual promiscuity has been observed in few of the kids. Use of drugs or alcohol as a part of the anxiety, shame, guilt that they carry, or retreat into fantasy so as to have a better world around them. The online activity needs to be monitored. We all know we are in the era where it is practically difficult to monitor online activities of the children, even at home. The parents would agree more than anything else. So the suggestion, if at all, it's like one has to keep checking for what is their data history, what is their activity history. So if it is suggestive of images, inappropriate content, distress messages, that could be, just popping up on an independent child profile, or even at times using a parental account, that could be a cry for help. So please identify that the child needs help and is not doing it because they are too curious to know about things. So maybe the first thing we need to ask is, right, why are you doing this? Is it that, or is it age appropriate, or is it not age appropriate? So age inappropriate sexual knowledge. Behaviors may include the inappropriate play with peers, self or toys, or advanced understanding of sexual act, which generally comes or has been observed in the child who are being abused sexually. I really appreciate what Australia has done for the online social accounts. They have stopped the social media accounts for age 16 and below. So that's a bold step, and I hope that Indian government will also try something on the similar line despite all the resistance that is likely to face. So the indirect, how will the child disclose itself? Will it be able to give a narrative like all our clients or patients give it in one go? May not be there. Child may disclose abuse in fragmented ways to test the adult's reaction. So they will try to test the waters. If I say this, how will you react? Will you just shudder me off? Will you shush me off? Will you get angry at me? Or will you listen to me and try to help me, or will you ignore it? So the child is actually testing our reaction before giving the full information. It's important for team managers or staff to be trained in both detecting possible abuse and responding to disclosures, whether accidental or intentional. So what are the roles and responsibilities of the team guardians? Awareness and compliance with the POCSO guidelines, proper method of handling age appropriate and non-sexual ways when you are dealing with children. Stay aware of the child's right and safety protocol. stay informed about the best practices for ensuring child protection, actively report any suspicious activities to the school authorities or to the club authorities or the organization for which the child is representing. Most important thing is monitoring infrastructure for the safety. So it so happens that wherever the child is going for this being a sports event, so they could be using it for an hour or two, or maximally 3 hours, or weekends it could be longer, or there could be a residential camp kind of thing. So it's not the majority of the part of the day, but still infrastructure matters. It has to be a safe infrastructure to ensure that there are lesser risks, and the reports, if at all, or issues if at all arises, will be reported immediately. It's expected that the team managers will be attentive to unusual behavior or situations involving students and act responsibly, assisting in maintaining a secure environment by adhering to rules and protocols. So, it could be as simple as the light chali gayi hai, generally around the toilets or the restrooms. So, if the light in the corridor is not working well, it is a simple thing to bring it to notice of the administration or to the organization. Please get it repaired. It may take 8 days, I am not denying it, but at least after 8 days it will happen. But if you don't report, it will never happen. So it is as simple as being proactive as this. Monitoring restricted area and ensuring a safe premise is the most important thing. Ensure effective communication and conflict management within their roles. Policy and reporting. So each organization should ideally have a policy for how would they like to report the cases, or there should be a protocol that is set, and if at all there is no protocol, then there are guidelines, there are straight away, I won't even call them guidelines, there are notes in the act which say that this is how you are supposed to report. So immediately report the incident to authorities, take corrective measure to prevent recurrence, and not a corrective measure for the incident that has already occurred. Any attempt to tamper with the evidence, any attempt to cover the evidence or to not disclose is punishable offence. Develop a standard operating procedure for reporting a case under POCSO Act. So there could be a designated person who would do the needful. Maintain a strict professional boundaries while interacting with students. Never use abusive language. This is generally what happens because the team managers are generally adults, and there is a time. Like you have a staff room and you have a classroom. So in school there could be two different environments, but it is the same ground for the team managers to be around and for the kids also to be around. So when we are sharing a space, it is more important to avoid a language that is more of an adult language. So never use abusive language, inappropriate jokes or physical punishment for the child. Ensure that CCTV cameras are installed and functioning properly, and do not tamper with them. Always prioritize the child's safety and well-being while you're on duty or when you're doing your job. For the travel, there are guidelines. Permission has to be taken from a parent and guardian. I would go one step ahead and say that, like in ethical trials that we do, or we study, any research study that we do, any child who is below 12, we at least ask verbally, are you interested in doing or participating into this? And for anybody who is above 12, we take a written assent from them. So child may not understand all the consequences, but at least we will know if the child is really ready or not, because today the sports world is very competitive. All the parents want their child to be in everything, multitasking, multi-intelligent and whatnot. So sometimes the child really but he may not be wanting to do it. So it's really important to ask even the child, are you interested? Would you like to do it? So details of travel to be shared along including stops, the contact numbers and everything. Safety information about when for the camp or wherever it is for the match, and when the timings when you will be back, who will come to pick up, those kind of coordinations will be needed. Public transportation rules are to be followed, which could include most of the time a team goes in a bus, and then all the rules need to be followed, which include the bus and the cleaner rules that applies to all the school buses also. So for an outstation travel, at least one female teacher or one female team member should be there, so that unless it is an all boys team, so as to make them feel comfortable. Timing of the travel, like I said, voluntary participation should be ensured. Bullying and dominance within the team. We have seen this, especially in children. We have teams till under 17, right? So if you are dealing with POXO, we have teams under 17. So बड़ा बच्चा छोटे बच्चे को कहीं ना कहीं dominate करने की कोशिश करता ही है. So that needs to be stopped. That needs to be addressed wherever it comes to our notice. And please don't allow it कि हाँ ऐसे तो होता ही है. No, we are not in the era where we would say कि this is part of the team and this is what how we play and this is just happens. No, that is not allowed anymore. Drop-off procedure, that includes the part of travel. So the team manager will not leave the premises till the parent comes and picks up the child. Now let's come to the online safety guidelines. This may not be so much for the teams that are for the sports psychiatry, but I thought it's wiser to share them generally. Internet safety can be ensured. Staff-student communication. The team manager and staff should only email or call child if it is related to sports. Copying parents on parents' email. So any email that is sent to a child should be CC'd to their parents as well. And unless there is a concern that the parent only is mistreating the child. Social media boundaries. Staff should not connect with students on social media as far as possible. We know that club has a social media handle, and most of the children are following the club or following that handle, or there is a tournament handle, and where everybody is there. So, but if God forbid something goes wrong, this is not allowed by law. Permission for recording. Child should never be recorded in a way that makes them feel uncomfortable. Staff must always ask for permission before taking photos or videos of the students. Empower them to say no. So we have seen the movie Pink. No means no, and that should be respected even from a minor. Respect their choices for physical affection. Not all children like to be hugged. Not all children like to be held close, so that should be respected. Encourage an open communication with the children so that they will feel safe and protected. Create a safe and trusting environment. So, let's come to the important part, how to report. If the child discloses or it is suspected by an adult, report to Child Welfare Committee or police. Call police helpline either on 100, 1098. 1098 is now, since last 2-3 months, been diverted to 112. So even if you call 1098, it goes to 112. So whichever one you want to. That's 112 is the Mahila Bal Kalyan helpline. Police to register the FIR. They cannot deny registering the FIR. If they deny, the complaint can be registered even with the magistrate. It has to be in a child-friendly manner for the FIR. And of course, child cannot be detained overnight for filing an FIR in the in the police station or wherever. So the child is eligible for legal help, psychological support and medical help as a part of reporting. Consequences of failing to report. Failure to report child sexual abuse under the POCSO Act is a criminal offence. So, till everything is smooth, nobody will be responsible. But if, God forbid, one child is affected, and if there is somebody who has pushed it under the carpet, they will not be spared. The staff may face up to 6 months of imprisonment, heads of organization up to 1 year, along with fines or both. So now with this, I would like to add that this sounds very harsh, but it is important because for the implementation of the law itself, this is important. There have been times when we know that it anyway needs the entire village to raise a child. So there was somebody who was looking after or keeping an eye on the child, whether you know, you don't know. Somebody was reporting to the parents कि ऐसा चल रहा है, वैसा चल रहा है, कुछ तो होता था. It was taken in a positive way, or it was handled in a better manner or whichever manner. But at least parents are aware of what is happening. Now we are in the nuclear family, more concentrated families, and sometimes you don't know what will happen or what is happening or what your child is doing, especially with the online platforms. So it's better that we wake up and we stay awake or alert so as to safeguard children who are future of our country. Now there are certain terms like grooming, the process by which a perpetrator builds a relationship with a child, often their family, to gain the child's trust or lower their inhibitions, making them more vulnerable to exploitation or abuse. Perpetrator often works to manipulate the child to those around them and to maintain secrecy or avoid detection. If an incident has happened during the travel for the sports, whose responsibility it is to report for the same?
Whoever knows.
Yes, whoever knows. Whoever knows first is supposed to report. What should we do if the perpetrator is also a child or a juvenile? We still report because the perpetrator who is a juvenile will be handled by the Juvenile Justice Act as a perpetrator. What if the children or juvenile are in consensual sexual relationship? Does it fall under POCSO? Yes, it does. Should an incident which has happened a year back to be reported? Yes. So if the child is giving me a fragmented disclosure, I can still report. If the incident has occurred in a different state place, can we still report to the police of the current state place in which the child is staying? Yes. Does showing pornographic content to a child falls under POCSO? Yes. A false complaint against POCSO should be punished. Can it be punished?
No.
Yes, it can be punished, but the person will have to go through the entire ordeal because how do I put it? The onus of proving innocent is on the perpetrator or the accused, I would say in this case. So what should we do if the staff suspects a student is a victim of cyber sexual abuse? There are these guidelines. I think I'm running a bit late on time, so I will just leave it. So we can report to the National Cybercrime Reporting Bureau. We know that it needs to be reported and there is a helpline as well. So the take-home points: stay calm and listen without judgment or interruption. Be assured that the child that they are safe and did the right thing by speaking up. Do not investigate the matter yourself because everybody is not equipped with that. Not even every psychiatrist, every psychologist is equipped with that. Let the experts handle it. Report it immediately to the organizational authority, the Child Welfare Committee or the police. Do not ask leading questions or probing too much. Do not blame or shame the child. Do not promise confidentiality since reporting is mandatory. Do not delay reporting the case. It's every child's right to be safe, and the onus is on us. Thank you.
Does anyone have any questions for ma'am? We'll just take 2 questions because we're clearly running a little late.
Ma'am, in a hypothetical situation where a 20-year-old tells that at the age of 12 there was an assault, should we report?
Yes, sir, but it will not be, since the age is crossed, it will not be under POCSO.
No, is it mandatory to report?
Yeah, but it can be reported, but not under POCSO.
Is it mandatory on the psychiatrist to report?
Mandatory or not? Yes or no?
Yes, sir. That's all.
Yes.
Is it mandatory?
But
Yes.
adult and he can himself report.
Sexual assault as a child.
Yeah.
It's not a sexual assault as an adult.
Reported at 20
He's
years.
saying that when he was a child,
Understood.
so should we report or not?
Yes, as a psychiatrist, you have.
So,
do not have.
even if it has happened in the past,
Yes.
if we become aware of the fact that it happened as a child, it is on us to report, right?
Yes.
Because this question, this situation arises in our clinic very often, and I don't think so that any of us psychiatrists have ever done it. Has anybody?
So, I'll share it.
So we
I
are
will
into.
share my
Can I just answer this question? So it's because we are so much trained about confidentiality that when the child is or when an adult is telling you something, the adult is telling you something as a part of confidentiality. Now there are 2 ways of looking at it. The same this thing. If there is no immediate threat, this is how it is discussed. So if there is no immediate threat, again we are into ethical dilemma. Do I report it? Yeah. So but the threat continues. For example, it is by somebody who is one of the known person, and the threat continues. Then the answer is clear. Now again, the symptoms of the person that has now are because of this. And it's an adult who says, I don't want to report it. Right? So, all that we can do is encourage to report, but yes, it should be reported. Ideally, it should be reported.
One more situation I would like to ask you. It happened with me twice till now. That the minute I talked about reporting, parents just got up and ran. Actually ran away from the clinic. One was parents, second was a nurse sister and come with in one of the municipal hospital, sister was there. And she picked up everybody. She said, "Ata problem hora hai, chala." And they just ran away. This has happened twice. Now what to do?
We still report, sir. We still report to the police of our clinic area, and they are supposed to follow. You can report to the Child Welfare Committee of the government.
Right,
So-
but then unfortunately there was no phone number, nothing. Now I have records of phone number. That
Yeah,
time
so-
unfortunately it was not.
That's right, but so whatever we have, at least name we have or school name we have.
So we have practical solutions for this. Okay, how to report? Reporting is also important. One of our case was there, one child was admitted. And usually we take a lot of interns, psychology interns. Okay? And we feel they are very sincere, etc. And that intern, that lady was only 20 years old. She was also not older. But the child was 15-year-old who was admitted. But child was 6 feet high, 15-year-old. So somehow they started exchanging message on Instagram, etc., etc. And the child's mother came and started fighting. She is grooming. That lady is grooming. The 20-year-old MA psychology intern. From that point, we started taking undertaking for interns also. While coming in the clinic, you should behave with certain people. But in that case, what happened is that lady was started allegation was there. You should do something against it. So we have to report. So how to report? Report is another issue. So going to police station and sending something. The simple way to report is email the police station. You drop the email, ball is in their court. That is the simplest way. Okay? Another thing, we inform NGOs. There are a lot of NGOs working in this. There is one Muskan NGO working in Pune. We inform Muskan NGO, their counselors come and they take over the case. Finish. So our work is like that. We can inform to any NGO. They will come, they will take over and just email to the police station that our work is finished.
But you are lucky to have Muskan, but I don't think everybody is lucky
but
to
email
have.
to police station is also there.
That you
email
can do
is
even
valid.
to the,
Email is a valid document, so you can email to police. I think we can, if you get psychiatrist. So at least email. Nothing to worry about it. They have to investigate. Then after email, they will call us. Okay, this is the problem. Then the procedure will there. So this is the practical solution. I think.
Very practical. Absolutely. So, any more questions?
Yes.
Please.
I have a question. So, if we report this, So, if we report this is a psychiatrist, and what if the child or the parent they back off and they say नहीं ऐसा कुछ नहीं, so is there any harm on us?
No harm on you.
Just
we are doing something. We are doing something. Oh, that's.
Email is the best. There is no harm in email.
Yeah, my question is, if you come to know that any sports science professional is in a relationship with a minor athlete, I want to know about consensual, yes. But that has come through the parent, the child has not spoken. How do we go?
You can report and
the organization head.
Yeah, you can report to the child welfare committee, police.
Email.
And you can even mention that the parents are involved.
Parents are involved, yes.
So that the child will be taken care of.
Hello, ma'am. In patients who are like child who are not verbally very expressive about the whatever the incident happened. So what are the non-verbal signs which should alert the psychiatrist that these are non-verbal signs which child is not even trying to be expressive, but they are non-verbal, which we should understand that, which should alert the psychiatrist?
There are plenty of them. Like when you are somebody who is observing the child on a day-to-day basis, there is definitely a change in behavior. So if it was a chirpy public child, they can turn into a quieter child, does not want to or avoiding certain circumstances equally. Academic grade is one general parameter which I don't go by because that's not something that is for everything. I mean, academics can get affected by something, but an activity that a child loved previously and is definitely not wanting to do or has a total resistance for that particular activity, that is a suspicion for sure.
But in this case, there can be some other.
Last question, and very short and quick.
In this case, there can be some other psychiatric comorbidity. So how do we differentiate between that? This is because of a trauma caused by some incident, or there can be some like how to non-verbal, like it can be caused because of many other reasons, like child.
So you refer the child to a psychologist, get the child assessed. So there you can definitely will come to know. We have TAT, CAT.
Thank you, Dr. Sarika, for such a clear, very detailed presentation. Beautiful presentation, very clear. Thank you so much.
Now I would like to request the chairpersons to kindly felicitate our speaker. And I would like to request Chouhan again to. Okay.
Are Apurva, come on. And Kajal. Kajal, come.
Please come felicitate our chairpersons.
Both of you, one by one. अरे आला आपला संभाजीनगरवरून संभाजीनगरवरून आला
Such an important session, protecting minors is protecting the future of our school. पहले से वैसे हिस्ट्री मेरा काफी दिलचस्पी लेने वाला टॉपिक रहा है, तो उसी सिलसिले में कभी कभी कुछ चीजें ढूंढता रहता हूँ गूगल पे खासतौर पर, उसी को लेकर एक नया लफ्ज मेरी नजर में है, eudaimonia.
What does that mean?
It means human flourishing. It is about Greek mythology. Greek culture में साइकोलॉजिकल वेलबींग को लेके काफी काम हुआ, बहुत साल, बहुत सदियों तक, लेकिन वक्त के ढलते ढलते ये सारी जानकारियां कहीं इतिहास में लुप्त हो गई। लेकिन पिछले कुछ सालों में इन सब के बारे में वापस से चीजें उभर के आ रही हैं, इनके बारे में नए सिरे से हमें जानकारियां मिल रही हैं। उसी सिलसिले में एक लफ्ज है eudaimonia, जिसको कहा जाता है होलिस्टिक एक्सीलेंस, जिसमें फिजिकल, साइकोलॉजिकल, स्पिरिचुअल एंड मॉरल क्वालिटीज शुड बी प्रेजेंट इन वन ह्यूमन बीइंग। एक्चुअली इसको हम माइंड बॉडी कनेक्शन भी कह सकते हैं। उस जमाने का एक सबसे बड़ा फिलोसोफर प्लेटो, जिसने कहा था कि रोल ऑफ फिजिकल एक्सरसाइजेस इन अ वेल ऑर्डर्ड माइंड, यानी कि माइंड बॉडी हार्मनी के लिए फिजिकल एक्सरसाइजेस, स्पोर्ट्स, एक्टिविटीज, इनका होना बहुत जरूरी है। ये दोनों एक दूसरे के ऊपर काफी हद तक निर्भर करते हैं। सो जस्ट फॉर लिटिल बिट चेंज, कुछ ये जानकारी आप लोगों से साझा करना चाहता हूँ।
Now, on to the last session of the day. Everyone roll your shoulders back, stretch your necks. Do not sleep, please. The session is about sleep. You are not allowed to sleep. Okay? Remind your spine that you love it. And we would like to invite our next chairpersons, Dr. Geeta Chouhan and Dr. Bharat Mali, to please chair the session for us. These are my super seniors from Jagruti. I have literally grown up as a psychiatrist watching their work, so they don't need a formal introduction. And I would like to request them to please introduce our speaker.
So we have Dr. Merchant, who is a performance consultant and sleep specialist. She is a performance consultant and sports psychologist with 8 years of experience. She has done her PhD in cardiovascular sciences from University of Kerala. She with focus on sleep, dietary intake and food preferences. She has done her MSc psychology in sport from University of Stirling, Scotland, and MA in psychology with specialization in clinical psychology from Maharaja Sayyidina University of Baroda. IAM's expertise lies in the overall development and well-being of individuals and athletes while helping them be and achieve their best. She is a graduate member of British Psychological Society, a member of British Association of Sports, Exercise and Science, British Sleep Society, and certified CBT for insomnia practitioner. She is also a former district level basketball player. She has done a BA in music, that is Kathak dance. She has also undergone coaching in the field of hockey, rugby, and handball and skiing. She has written and presented multiple research articles focusing on athlete development, coaching behaviors, and coach-athlete relationships, and improving sleep and its effect on diet. Please welcome Dr. Ann Walsh.
Sorry everyone for the delay and for the technical difficulties. So thank you so much for having me here today, and I know it's the last session of the day, so please bear with me. I'm going to try to finish this as fast as possible. So I'm going to talk about cognitive behavioral therapy for insomnia. So my focus is more going to be on how the therapy is, how sleep works with sport, and how to implement CBTI essentially and how it works. So with that, just a little bit of an overview of what we're going to talk about today. So as I mentioned, I'm going to talk about CBTI, the efficacy of the treatment, how it ties in with pharmacotherapy, how you can integrate it into sports medicine, and pros and cons and challenges that we face while practicing CBTI. So we start with the statistics because I like studying people as much as possible, and one of the biggest questions I get asked from athletes is how much should we be sleeping? And the answer is at least student athletes need about at least 9 to 10 hours of sleep. Are they sleeping 9 to 10 hours? I do not think so. So what happens? most athletes I come across usually end up sleeping less than 7 hours a night, primarily because they're doing homework, they're doing tuition, they're doing extra classes and multiple different curricular activities along with their sport. Sleeping less than 7 hours equals almost double the risk of getting injured. It also increases the chances of making mistakes, affecting things like shooting accuracy and serve accuracy in sports like basketball and tennis. However, recent research has sort of focused on what happens if you sleep well. And what they've found is that not only do we see an increase in the performance, there's also an additional increase in mood, daytime fatigue and sleepiness as well. So clearly, if you're sleeping better, you're performing better. And that's what I'm here to talk about, is how does sleep integrate itself into sport, why is it so relevant, and what CDI involves. So we know that sleep has a lot of effect on performance. So we start out with the basics, which is we know that there's endocrine function, growth hormones, appetite regulating hormones, immune function, all of these things are regulated when we are in our stage 3 of non-REM sleep and our REM stage. So we know that our body is actively trying to repair itself from the wear and tear of the body. And so for an athlete who undergoes so much physical and mental stress, that physiological growth and repair, especially when they're younger, becomes even more important. So that's the first stage of it. And immune function, just the ability to not fall sick at every given opportunity. Along with that, we're looking at things like cognitive function, memory, and neuromuscular performance, which means, are you able to pay attention? Are you able to concentrate on the task that you're doing? Are you able to effectively learn a new skill? All of these things again get integrated when we are doing our deep sleep and when we are in our REM stage. So just from the point of view of an emotional, physical well-being perspective, sleep does a lot for recovery. It is the most natural form of recovery. Everything that we do with regards to PMR and mindfulness and breathing exercises, that is all adjunct to it. The primary recovery that an athlete will get from their sport comes from the basic aspects, which is getting a good night's sleep to perform. And in the current day and age, there's multiple things that athletes are struggling with. So you take school, you take your training sessions, you take practice, you take competitions. Everything basically induces stress in an athlete. So that's the first issue. Along with that, we're constantly moving from one place to another. When it comes to touring or playing tournaments, you're constantly moving from one hotel room to another. You're traveling from one place to another. So the sleeping environment. We also have, for adult athletes, things like alcohol, caffeine, and drug use. And drug use does not necessarily just mean drugs, it's also inclusive of the medications that they take. We also have chronotype. Some people just work better at night. Some people, but unfortunately the world is not built for them. It's built for people who work in the morning. So how do we adjust that? And then of course, just competition head. Let's just go on to full-on training mode. That's the basic aspect, right? That's what all the coaches, every sports science, SNC, physio will do. Training means let's increase the training load. That also affects how well you are sleeping. So we have a lot of this sort of different aspects that we work with when we sort of are dealing with an athlete. And all of these sort of are going to cause some form of sleep fragmentation or sleep difficulty, right? So how can we essentially resolve this? And this is where I come in with cognitive behavior therapy for insomnia and how it works. So when we're looking at insomnia, I think everyone in the room knows the definition of insomnia, which is difficulty initiating or maintaining sleep. And usually the most common causes of this are either some form of maladaptive behaviors or your maladaptive beliefs that you develop over a period of time. And usually most physicians will end up saying, here's a benzo, here's a zolpidem, you're going to sleep better, right? While it physically knocks the person out, more often than not, we get complaints of excessive grogginess during the daytime and excessive daytime fatigue because they're not actually sort of as efficacious as we think they are. Okay? So we start out with how insomnia sort of develops, and this is essentially the base of where CBTI comes from. So this is Spielman's model of insomnia, which came out in 1987, which essentially says that we all have certain sort of predisposing factors. We're all sensitive to light, noise, we have a tendency to worry, we have a tendency to ruminate, we have certain illnesses, whatever it is. But we have certain predisposing factors that can affect our sleep, but they don't, right? We all have a threshold for that sleep. Now what ends up happening is, we have precipitating events. So this is going to be some kind of stress, okay? You're moving too much, you have a change in job, or some kind of a loss, injury, illness. For athletes it could be competition stress, exam stress. So we have certain precipitating factors that trigger a disturbance in our sleep. Now once that stress subsides, sleep goes back to normal. But sometimes the stress doesn't subside immediately, it stays. And when it stays, we start developing what we call perpetuating factors. And this is the cognitive and behavioral factors about our sleep. We start sleeping in, we start napping, we start spending excessive time in bed trying to go to sleep, making sleep effort, and we start developing things like, oh, my sleep is very fragile, my sleep is very poor, am I going to be able to sleep at night? So the combination of these factors sort of remain. And now what's happened is, if you see the stage 4, which is that the original stressor has absolutely subsided, but the behaviors and the thought processes are now remaining, and that's what's causing the sleep difficulties, right? So this is where CBTI comes into play. So it is now considered to be the first line of treatment when you're dealing with insomnia and sleep difficulties. There's been a lot of work done around this area, so it's evidence-based research, and it's found to sort of provide long-term benefits and durability compared to other forms of treatment, and we will talk about that as well, with far-reaching results for up to over a year. And it's shown to improve sleep by an average of 6 hours and sleep efficiency by almost 85%. And while when we talk in the therapy sense, therapy is a long process. CBTI is comparatively short because you start seeing effects between 6 to 12 weeks. The client is usually out of the therapy sessions. And it reduces dependency on hypnotics by almost 50%. So CBTI is clearly a very effective form of treatment. So what does it involve? So I hope you can read that. But we start out with Sleep 101, which everybody here in the room will know, which is called sleep hygiene, right? And sleep hygiene usually starts with have a standard wake-up time, get out of bed if you can't sleep, make sure that the room environment is comfortable and adjusted and suitable for you. So these are all the basic aspects of sleep that, in all fairness, none of us follow, but we tell our patients to follow. And usually this is just to try to curb a lot of the maladaptive behaviors that are there. So CBTI focuses first on the behavioral side of things and then gets to the cognitive side of things. So it's almost like a treatment plan that you provide. We then go on, once the first week is done with the sleep hygiene, there's a routine that's been established, we start moving on to the next part of it, which is sleep restriction therapy. As the name suggests, what we do is we calculate the sleep duration and then we restrict the time in bed to that particular duration. This is a particularly difficult phase of the therapy because the athlete or the person you're working with usually feels sleep deprived, but they're not. They're essentially sort of squishing together all the hours of sleep that they're getting. Instead of getting it separately, they're getting it all together. So it reduces the fragmentation, therefore increasing the quality of sleep that the person gets. Once the restriction happens and works, we start titrating or start increasing the time in bed by 15 minutes on a weekly basis, thereby working on the sleep duration. So the sleep restriction sort of works on both those areas. And then we go into what we call sleep compression, which is sometimes, we use this a lot with older people, but it's a gentler version of the restriction where you work on the opposite idea, where you first slowly start compressing the sleep until you reach your desirable sleep duration. So The final stage of the behavioral aspect is then the stimulus control, which is the key aspect to most sleep-related issues, which is get out of bed if you can't sleep, give yourself 20 minutes, go do something that's low stimulating, come back to bed when you're feeling sleepy, right? This is essentially the behavioral component of the sleep, and usually takes about maybe 3 or 4 weeks until we get to a good stage and the person started sleeping effectively. Now we work on the cognitive side of things as we attack what the stressors are. So this is where we start doing cognitive restructuring. So again, we work on the beliefs, we work on the thought processes. So here we're doing worry sheets, we're doing stress management, we're doing thought recording, we are doing biofeedback. So we're doing multiple different aspects that sort of working on managing that stress as effectively as possible. And then finally, we go into the relaxation techniques, which is the mindfulness, the breathing, the PMR, as an adjunct to that stress management, right? So this is what the CBTI in brief talks about. If you have any questions, I'm happy to sort of answer them once the talk is over. But essentially, what CBTI has been found to do is, so this was a paper that, a systematic review and meta-analysis that was done in 2019. And what it essentially found was that at 3 months, maybe CBTI was effective. At 6 months, it was effective for all the sleep parameters, including the subjective sleep measures, which is the Insomnia Severity Index and the PSQI, the Pittsburgh Sleep Quality Index. But at 12 months, even though both those subjective parameters don't show those results, what we do find is that the sleep efficiency, the sleep latency, and the wake after sleep onset, which is the multiple awakenings during the night, have still reduced, or are still reduced at 12 months post-follow-up. So clearly, the research states that CBTI has very effective results in terms of maintaining the sleep and essentially focusing on the behavioral side of things as well as the cognitive side of things. So, in terms of the efficacy, we find that it improves both the sleep duration quality, it ensures the rest and recovery, it ensures that you're managing your stress and anxiety effectively, and especially with young athletes who are working in the line of, say, skill learning or skill development, it's very, very effective. And then, of course, just maintaining overall function and mental health over a longer time period, right? Now, most people here will ask the question, what's wrong with the medication side of things? Absolutely, medications, I would probably not have an issue with that. Mainly because for something that's short-term, say somebody's going through a stressful period and they need the medication to sustain them for that duration, well and good. Medications are very effective for short-term insomnia. They have a very rapid, they show very rapid results. However, what happens with a lot of clients is there is an increased risk of dependency and an increased tolerance, which means that you would have to keep increasing the dosage of the medication. So for short-term insomnia, medications absolutely great. But if somebody's struggling with the chronic insomnia side of things, then the CBTI becomes more effective because A, it's a gradual form of therapy, it's long-lasting and has minimal side effects. So, a couple of, again, just statistics that came out, this was in 2012, where they did a study where they compared CBTI with benzodiazepines and what we call RZ drugs, which is arzopidams. And what they found was that short-term CBTI maybe was not that effective. The medication clearly had better results. However, over a longer period of time, in both benzodiazepines and the non-benzodiazepines, CBTI seem to be more effective. So clearly, for short term, medication works really, really well. And this is a similar result, and I know that the numbers are really small, so I do apologize. But basically, this was a study that was done in 2023, and they looked at the same thing. They looked at pharmacological therapy versus CBTI over a year, over 6 months. And again, as you can see at baseline, initially the medication seems to be more effective, but then as time progresses, the CBTI seems to be far more effective. However, this particular paper also looked at a combination therapy. which looked at both pharmacological and CBTI, and they found that the combination of the medication plus the CBTI was the most effective form of treatment, which means that you can start out by maybe giving the client medication to cope with the sleep, refer them probably to therapy, and then with the therapy they can eventually get tapered off the drug and eventually off the therapy as well. So clearly the combination therapy seems to be the most effective form of treatment. To quickly recap on the pros and cons, while there is long-term efficacy, you also need motivation. And this is one thing that we struggle with the most in terms of clientele. People are sometimes not willing to make the lifestyle changes, so less willing to engage with the therapy because of that, and the motivation levels. Of course, time and resource intensive because there's not a lot of CBTI specialists out there. And then there's delayed onset of benefits, which means that you do have to wait for a couple of weeks before you actually start seeing the changes. And the biggest one is, it's not a quick fix, which can be the most difficult aspect for a client to manage. However, if you do undergo the therapy, clearly it has long-term effects, there's very few risks involved, it improves both the quality as the duration, and most importantly, it prevents relapse prevention, because if a patient does relapse and and start suffering from insomnia symptoms again, they have the necessary skills to do the therapy themselves, and therefore they don't need to come back into therapy in most cases. So how would we address the challenges that we would have here today? One would be patient adherence. So you would try to use, say, motivational interviewing, and we try to reinforce the benefits of the therapy. We would deal with provider skepticism, which would be we try to share the evidence of the efficacy around the treatment as well as the cost effectiveness of the treatment. And finally, to try to incorporate CBTI apps and online resources to extend the reach out to multiple people due to the shortage of personnel that are there. And while most of you will think, okay, we're talking about insomnia, but what about other sleep-related issues? CBTI has been found to be extremely effective in patients with different comorbidities as well. So people with COPD, with asthma, with sleep apnea, especially when they're dealing with CPAP adherence, CBTI is extremely effective and can be offered alongside the PAP therapy. Along with that, you have sleep disorders, parasomnias, periodic limb movement disorders, restless leg syndrome, narcolepsy, nightmare disorders, you name it, CBTI can be used as an adjunct therapy to help with the treatment of each of these different sleep-related disorders. So it's not just something that's confined to the insomnia domain, it is something that's defined overall. It sort of extends its reach into other sleep disorders as well. And more importantly, patients with mental health issues, including anxiety and depression, because of the cognitive side of things, we're able to help them navigate that anxiety and those depressive symptoms a lot more effectively. So, I'm almost done, I promise. In terms of the training, CBTI, how it works is you usually get trained by a licensed organization. Unfortunately, there are not a lot of organizations who do the training programs, and currently the only sort of official training programs are those that are recognized by the American Association of Sleep Medicine. Based on that, we then start by providing customized sleep plans. So we try to have a patient-centric approach. We ask them to do sleep diaries. We do actigraphy assessments, polysomnography, and we try to get an understanding of the sleep-related difficulties. We then try to look at collaborative care. So when we're working with an athlete, we're not just working with one person, we're working with the SNCs, we're working with the physios, we're working with the nutritionists, psychologists, psychiatrists, coaches, parents, everyone. So it is important that when we're working with sleep, there needs to be collaborative care, because that helps us understand whether an athlete is at risk for burnout, whether an athlete is suffering from some kind of mental health issue, or whether the athlete is maybe simply just not getting enough nutrition. So it is a more of a collaborative care approach, and to try to use digital. So in my practice, I try to do as much online work as I can to try to sort of provide that client support and conduct as much remote therapy as possible to try and reach out to a wider number of individuals. So, in conclusion, CBTI is a safe, effective, evidence-based alternative for treating the insomnia. Its integration sort of focuses and combines with the modern healthcare priorities that we have. And when we what we need to do is we need to start integrating the CBTI in client care to improve the outcomes that maybe simply by using pharmacotherapy may not be that effective. And that's pretty much it for me. I hope I have So yeah, sorry for the quick presentation, but if anyone has any questions.
So I do have a question. Yeah. I'm wondering if people are going to be like, oh, we're already, overshooting the time. No, but so, of course, I read and heard about the effectiveness of, you also said that you're hearing about it. My question is, there are various conditions. Sleep per se is not just an independent problem a lot of times, right? So, how effective is it for mild depression, mild anxiety, for someone who's not on medications? Is there any data on it?
Okay, so one of the big things that when I work with sleep is, sleep at the end of the day we need to understand is the behavior. And more than the cognitive, it's the stress that exacerbates those behaviors, right? That's why we work on the behavioral side of things first. What we usually find in CBTI is, once those behaviors are curbed, you start feeling a lot better. And that is it. Sometimes I get people who come in with maybe, when I calculate their sleep efficiency, maybe 60-70%, and they're feeling low, they're feeling fatigued, they're feeling very anxious, unable to cope. 1 week of sleep hygiene, 90% sleep efficiency, gone. They're able to manage their day more effectively, they're able to manage their routines more effectively. And what ends up happening is, I keep telling this to my patients, one of the things is, we start saying that we start living to sleep. When people are struggling with sleep difficulties, they start living to sleep. Will I be able to sleep? I'm like, no. Sleep is a behavior and it's a part of your life. You have to sleep to live, not the other way around. So you have to. So once that idea gets in, the importance of sleep reduces and they relax. They're able to sleep a lot better. So a lot of that, it's the anxiety around the sleep that we're targeting rather than the actual sleep itself. Thank you.
Now I would like to request our chairpersons to kindly come felicitate our speaker.
Thank you so much.
Now I would like to request Dr. Prabhu to come felicitate our chairpersons.
And Faizan.
Dr. Faizan, can you please join us on stage?
Right side, sir, to right side. Yes. Look at the camera. Thank you.
Thank you so much, everyone.
Yes, sir. Look at the camera, sir.
As we come.
ते दोघांचं राहिलं की प्रणव दोघांचं आहे का असं
Anything is like visibility, keep talking to nobody drugs, and we have been your wise. We love it.
Felicitate our great actors, celebrity actors, I would say.
Thank you so much. Please.
Go ahead.
Thank you to the team of Jagruti Rehab for organizing all this. Thank you, Dr. Ayan, for, of course, I have to share this. When I called up Ayan, I heard a female voice. And I told her, I was expecting to talk to Dr. Ayan, and she's like, that would be me. So I'm sure you come across this very often. So thank you for the wonderful lecture. I would thank the IPS subcommittee for all their permissions and efforts. I would thank Team Jagruti and the wonderful audience here. Team One Performance. Thank you again. Thank you.
With that, I don't think anybody's listening to us anymore. So that's me.
Oh yes. Thank you to Neha and Saraj for such wonderful answering and giving us some tidbits and knowledge from here and there. And to the wonderful audience who still managed to stay back. And thank you to all the pharmaceutical companies. Linux and Ardent and Intas. Have I missed someone? That's Intas, yes. And Olive.
Okay. Thank you.
हमारे जाने के बाद महफिल में अफसाने बयां होंगे, बहारें हमको ढूंढेगी, न जाने हम कहाँ होंगे। Thank you.
Oh, Dinesh.
Just a second.